mutual respect, so we can thrive all together, paving the path of a bright future for our coming generations. Grant us the ability to embrace each other, welcoming the stranger, feeding the hungry, sheltering the homeless, clothing the naked, and providing for the poor and the needy among us. Almighty Creator, the source of all being, the most gracious, the most merciful, in your name we pray. Amen.
Thank you, Imam. The Pledge of Allegiance will be delivered by Raquel Bocoli's third grade class from Logan Memorial Elementary Campus. We welcome the third graders to lead us in today's pledge, and we will turn it to you all to take it away.
All right, boys and girls, put your right hand over your heart and ready, begin.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you to our wonderful third grade class from Logan Memorial. With that, we will move into before we move into the presentations of proclamations and awards, I want to take a moment to appreciate and celebrate Don Stoyer. This is his last board meeting as we begin to scale back incident command and turn over those responsibilities. Don will once again head into retirement. I think this is probably the 17th time this board has acknowledged and recognized his service in retirement. But Don, in all seriousness, we appreciate everything you gave to our country and everything you gave to our county and your willingness to stick with us, postpone your retirement a little bit to guide us through COVID-19. And we appreciate all that you've done and wish you the very best in retirement until such time as you come back again. With that, let's first proclamation will be presented by myself, recognizing Mental Health Month. Wrong folder. Today we honor May as Mental Health Month. This is a month designed to draw attention and focus to the issues of mental health challenges in our society. We know that they affect an estimated 1 in 5 adults in San Diego County, but the reality is it would be hard to find anyone who has not had their life touched or impacted in some way by a mental health challenge or illness. Whether it be them or their family members. We know that there is a pervasive stigma that exists throughout our society, and as a part of Mental Health Month, we seek to break down that stigma, to talk about how do we integrate health in terms of your entire health, your physical health, your mental health, your spiritual health, your soul, all aspects that give us a life worth living and a well-deserved and profound and impactful life, with mental health being an important part of addressing those and breaking down those stigmas and access to services and availability of services, of willingness to get services. And so we stand here today to really proclaim and talk about this issue in a very public way and to double down and recommit ourselves as a county to doing everything we possibly can to do right by every San Diegan out there. Even in more, quote, normal times, a primary concern for San Diego County is the health, safety, and well-being of our residents. But in the times that we're in today, both the impacts of the pandemic along with the state of affairs in our country, we know that today behavioral health, the combination of mental health and drug treatment, is more important than ever before. Taking care of the mental health needs of San Diego is an incredibly complicated task with intersections of local policies and state and federal and health systems and insurance and hospitals and reimbursements and education. But helping us guide through all of that in our efforts to build a better way is our incredible Director of San Diego Behavioral Health Services, Dr. Luke Bergman. And I am incredibly grateful to Dr. Bergman, relatively new to our county, but came in with a vision, with a commitment to evidence-based practices, with an understanding of the totality of the system, and someone who works incredibly hard every single day to help us drive change, and change is hard. Doing things different is hard. And along the path to provide a better outcome, it's going to at times be a little bit of a bumpy road, but we have that commitment because we care for one another. And I am so grateful for Dr. Bergman's willingness to work through these difficult and thorny and challenging issues and help us drive change in a positive direction. Also with us today is Mona Minton, the Vice Chair of the Mental Health Contractors Association, representing all of our hardworking and very committed service providers, often the boots on the ground who are out providing the services in difficult and challenging environments. And we recognize, Mona, you and your organization and all of your providers. And of course, our incredible chair of our Behavioral Health Advisory Board, Judith Yates. The BHAB board is made up of appointees from all the supervisorial districts, and it really represents consumers, families, experts in the field who advise and shape our behavioral health system. And today we are going to hear briefly from all three of these individuals about their work, about their commitment, but really today we're here to honor and proclaim the work that you all do, to recognize it and to commit ourselves to what we have to do moving forward. We know that we can make a huge difference in the lives of San Diegans. We know that things are moving in the right direction, but we are also reminded that we have a considerable way to go. And so on behalf of all of the members of the San Diego County Board of Supervisors, this 18th day of May 2021, we declare that all community efforts to improve mental health of county residents are commended, and that the month of May 2021 is hereby declared to be Mental Health Month throughout San Diego County. And joining us first is Dr. Bergman.
Thank you so much, Chair Fletcher. I want to thank Judith Yates, our courageous chair of the Behavioral Health Advisory Board. It's been a really challenging period, of course, for everybody. Logistics are challenging in new ways, and Judith has kept this critical piece of our county's behavioral health infrastructure moving in a determined direction. Really ably, and we all owe her a real debt of gratitude. I want to thank Mona for your both genuine and still somehow always diplomatic leadership of the work that the county contractors do, which is, of course, the systems that provide the care. So thank you so much for everything that you're doing. Chair Fletcher and board, we owe you incalculable debts of gratitude. I think for making behavioral health the highest priority in the County of San Diego, for making San Diego County a national leader in behavioral health work. And I think especially for so effectively drawing a through line between mental health and mental illness. And noting for all of us, making clear for all of us that just as we care for all of our mental health, we need all of us to care for all of our mental illness. We shouldn't be afraid of it. We shouldn't punish it. We should embrace it and care for it. And the clarity of your leadership around that challenge is one that I am particularly heartened by and grateful for. Thank you.
Come on, don't be shy.
Just a little nervous. Thank you, Chairman Nathan Fletcher and the board. Mental Health Contractor Association is very honored in the 20+ years work that we've done. This is a great honor to receive a proclamation for our hard work to be recognized. And I know I would like to plagiarize Luke's speech because there's a huge difference between mental health and mental illness. I have lived experience. I've been sober and clean for 14 years. So I know that it takes a lot to take those steps in recovery and acceptance. And all of our members, as well as our board with MHCA, also has some form of lived experience. And this is why we are dedicated to be part of MHCA and continuing to partner with BHS. And Luke has been amazing and his team in helping us with our contract needs and our compliance stuff. So thank you so much.
Well, now that everything has been said, my job here will be easy. First of all, it would not be okay not to turn and thank you for this and your colleagues. It is an honor to be up here representing the Behavioral Health Advisory Board. and especially in the month of May. Month of May is a special month for lots of people for very different reasons, graduations, et cetera. For us in this community of behavioral health, it's our month to celebrate all that we've endured, all that we've gained with the help of our Board of Supervisors, and at the same time, it's a great month to kind of reinvigorate and recommit to all the things that we still need to do in the future, because the challenges, unfortunately, will be there, but the end goal we all share stays the same, and that's to have a community that's not just healthy, but that is thriving. So thank you again. It's a pleasure to be here.
We're almost done with those. Not quite yet, though. Not quite yet. Not quite yet. Almost done. Couple weeks. May is also Asian Pacific American Heritage Month, and today, May 18th, is the birth date of Vincent Chin. Vincent Chin was brutally murdered by two men in a hate crime in 1982. At the killer's trial, the men each received a $3,000 fine and 0 prison time. His murder and the failure of the criminal justice system fueled a national Asian American activist moment that continues to this day. In honor of Vincent Chin, May 18th is also known as AAPI Day Against Bullying and Hate. And over the course of the last year, we have seen a staggering and shocking rise in bullying, discrimination, hate crimes against Asian Americans and Pacific Islander community, in part fueled and driven by the COVID-19 pandemic. And on behalf of the entire Board of Supervisors, I want to take this moment to let the entire AAPI community know that your Board of Supervisors stands with you and stands with our community, and we condemn any act of bigotry against any community out there. And we stand in solidarity both with our words and with our actions to convey the importance of this community and the strength and diversity that comes in San Diego County because of each and every group that is there. And when we see a group that is targeted, we will stand and we will say that that is not right. And we're so fortunate to have organizations like San Diego API Coalition in our community and with us here today. Their mission of facilitating conversations with organizations, of amplifying and cultivating leadership, acting as a hub for the API organizations to collaborate, helps lead us to a more inclusive, more equitable, more fair, and more just San Diego. Last month, alongside Vice Chair Vargas, we brought forward our resolution denouncing xenophobia and anti-Asian racism, and which our entire board supported. And today, as chair, and along with all the members of the Board of Supervisors, are pleased to proclaim the 18th day of May, 2021, San Diego API Coalition Day Against Bullying and Hate throughout San Diego County. And we appreciate all of your work. And I believe we have Alex and Kent here to say a few words, and we welcome you and thank you for what you're doing.
Good morning, Chair Fletcher and supervisors. And my name is Kent Lee, and this is Alex Villafuerte, and we serve as the co-chairs of the San Diego Asian Pacific Islander Coalition. On behalf of all of us in the coalition and within the API community, we want to thank the supervisors for taking this opportunity to once again speak out against anti-Asian racism and hate, but especially for bringing to light the concerns around bullying, which we know is impacting young people across the county. The API Coalition formed last year in response to increased hate and racism directed towards our communities. And as you know, we've seen an uptick once again in incidents both at the start of this year, as well as through a significant jump in reporting thanks to recent awareness. In fact, as of March 31st, now more than 6,600 incidents of hate and racism have been reported across the country since the beginning of the pandemic. An especially important note is that in addition to the number of cases that have impacted the elderly, 10% of reported cases have actually involved young people under the age of 18. If we look at the disaggregated data for San Diego County alone, we know that over 100 cases have now been reported since last year, a 240% increase in the number from which we had just a few months ago. As schools return to in-person learning, we understand that this is a critical issue to address, both in awareness of incidents of hate in general, but also looking at how we can strengthen education that promotes understanding and compassion. The API Coalition, in fact, has formed a youth task force specifically to evaluate impacts to our local communities and our youngest community members. And we hope to work together, simply not to respond just to the crisis, but to build for the future of our communities. We look forward to continuing our collaboration alongside the County of San Diego, not only in addressing hate against the API community, but in recognizing that we must stand against bullying, hate, and discrimination in all forms, and that which impacts all of our fellow marginalized communities. Thank you once again.
Thank you. Thank you both. Our next proclamation will be brought forward by Supervisor Tara Lawson-Remer, and honoring Unite Here Local 30 and accepting this proclamation will be Bridget Browning.
Great, thank you so much. Bridget's not here today, so I'll be presenting in virtually today as well. I'm sure we will get back to normal in the coming months. Earlier this month, we celebrated International Workers' Day and recognized some historic leaders that have shaped our region for a more inclusive San Diego. Today, it is my honor to present this proclamation to honor the workers of Unite HERE Local 30 in creating a more inclusive union in San Diego County. Unite HERE is a diverse union composed largely of immigrants and women, including many African Americans, Latinos, and Asian Americans in the hospitality industry. Collectively in San Diego, they represent over 6,000 individuals. In the face of hate and threats of deportation, the members of this union, workers in the hospitality industry, Local 30 has worked to promote inclusion of an immigrant workforce, striving for economic justice through dignified wages and benefits. Unite HERE Local 30 members have bravely taken action out in that world to resist hate and humanize the struggle of San Diegans who are immigrants and working families. As a board, we are committed to recognizing such organizations and uplifting the work they do in our community. I look forward to seeing and meeting with Unite HERE leadership and members at an upcoming meeting and ensuring we work together for a more inclusive San Diego that uplifts and supports everyone. Today, joining by Zoom, we have Bridget Browning, who will be accepting this recognition. Thank you for joining us, Bridget. I'll hand it over to you now.
Thank you so much, Supervisor. I want to thank you all for recognizing the work that we've been able to accomplish at Local 30. I can't really take the credit for it. We have an amazing membership. Many of them risk their lives to come to this country to provide a better life for their families. And we're often very invisible, intentionally. You don't really see us in the background, keeping your plates clean and your room clean. So the fact that you all are taking time to recognize our folks is very, very meaningful for us. And it really shows that there's a new day where we're turning the corner away from hatred, in particular against immigrants who, frankly, our economy could not function without them. They do jobs that many other people would not be willing to do. And it's our mission to make sure those jobs lift them up into the middle class. And I just really want to thank you, because I know you're all very busy, for taking the time for recognizing our folks.
Thank you. Thank you, Supervisor Lawson-Remer, and thank you, Bridget, and thank you to all of your members for what they do. The last proclamation today will be given by Supervisor Jim Desmond. Present the proclamation honoring Water Safety and Drowning Prevention Month. Accepting this proclamation will be Nicole McNeil. Supervisor Desmond, we will turn it to you.
Thank you very much, Mr. Chair. As you mentioned, yes, today I'm honored to bring awareness to Water Safety and Drowning Prevention Month. And I know Nicole McNeil, I think she's on Zoom here today with us, and I have the proclamation here. We'll have to, I can't pass it through Zoom, but we'll get it to Nicole here. But the Centers for Disease Control and Prevention found that drowning is the leading cause of unintentional deaths in the United States for children ages 1 to 4. Also, 1 in 5 people who die from accidental drownings are children 14 years of age and younger. Each year, drowning incidents result in hundreds of emergency room visits, including hospital stays and potential life-altering and unfortunately permanent disabilities for San Diego residents and visitors. San Diego residents and visitors have access to over 70 miles of coastline, 20 freshwater lakes, over almost 7,500 public permitted bodies of water, such as apartments and apartment complexes, swimming pools, backyard pools, making drowning a higher possibility in our region. So water competency includes water safety awareness, basic swimming skills, and provides assistance to those in need, such as CPR. San Diego residents and visitors can learn more about water competency through water safety banners, media messages, safety events, promoting swim skills, life vests, rescue techniques, and water watcher tags that are worn by the adult who's responsible for protecting children from drowning. County of San Diego is committed to recognizing and honoring those organizations who are dedicated to the best ideals of public service, and Prevent Drowning Foundation of San Diego is one such organization. So now today, the San Diego Board of Supervisors commend Prevent Drowning Foundation of San Diego for their commitment to community safety, and do hereby declare the month of May to be Water Safety and Drowning Prevention Month throughout San Diego County. And Nicole, if you're there, if you wanted to say a few words.
Absolutely. Thank you so much to the board. Thank you, Supervisor Desmond. Drowning is real, and thank you for making a priority drowning prevention. The thing is, with the foundation, we've worked so hard over the years, and it really does take a community effort, and we need to spread the word. There is education that we can provide to our communities that will no doubt make our communities safer. So we want to provide every child the opportunity to learn basic fundamental skills that can save their lives, being able to jump in deep water, tread water, float on their back, swim to an exit, be safe at the beach. Once kids learn how to swim, then there are more opportunities. They can safely enjoy activities at the beach. They can join swim teams, water polo teams, and go on to become lifeguards and pool guards in their community and provide more safety awareness for their fellow community members. So we really appreciate this today, and we'll do our best to keep spreading the word and teaching more children how to swim.
Well, thank you very much. And today we have an item 18, that's going to be hopefully also promoting water safety and putting some dollars towards that effort as well. So thank you very much, Nicole.
Thank you, Supervisor Desmond, and thank you, Nicole. Next on the agenda is non-agendized public communication. This is an opportunity for the public to address the board on subject matters within the Board of Supervisors' jurisdiction, but not on today's agenda. The only action the board may take is a referral to the Chief Administrative Officer, and a reminder, according to Rule 4A, members of the public that are non-English speaking and need interpretation assistance will get twice the allotted time for their comments. At this point, I would ask the clerk to call forward the speakers, and I ask for everyone to indulge a little bit of patience as we do a hybrid of in-person speakers along with virtual speakers, so we will work through this, no doubt, very seamlessly, but I'll turn it over to the clerk now.
Thank you, Chair Fletcher. We have 2 requests in person and 11 requests to speak by phone on matters not listed on the agenda. Any members of the public that have requested to speak during non-agenda public communication by phone, please dial into the conference line now using the instructions that were provided to you. As a reminder for the callers, if you requested to speak on a specific agenda item, please hang up and call back when the board begins discussion of that item. We will begin with the in-person speakers. When I call your name, please line up on the physical distancing stickers in the hallway outside the board chamber on the 3rd floor. I would like to invite forward Emmanuel Calmaneras and Shayna Dunn. You'll have 2 minutes to address the board, and I'll ask you to please state your name for the audio record. And again, we'll invite forward Emmanuel Calmaneras and Shayna Dunn. And if you could please state your name for the audio record.
Hi, my name is Emmanuel Cominares. Good morning, Board of Supervisors. Thank you for this opportunity. Today I'm here to reopen San Diego, and I'm here to talk about why I oppose the lockdowns and the message that San Diego has been sending to its residents. From the beginning, health and science were never the concern for the population, but rather control and power. With the gyms closing almost immediately, the focus from our county was to socially distance and to mask up. At the time, I was working at a clinic for people with disabilities, and we had to transition to the Zoom. And with that, the therapy that they needed was not sufficient. Their caretakers were unable to do it. As well, I spoke to dozens of business owners, and with the lockdowns of the indoor dining, it proved to shut many of those businesses down, businesses I knew and people I knew. Others flourished once they were able to reopen. But there was no scientific data that provided that the indoor dining should be shut. Nonetheless, we have moved forward and provided services for them, so thank you for that and helping them to this day. But in this health crisis, it is vital to take care of one's health. Yet the emphasis continues to be on social distancing and masking, even when the CDC has updated its regulations. Other states, such as New York, are opening up tomorrow, and California is one of the it's number 25 in the vaccination rates, and with San Diego County having a vaccination rate of 56.6% of its population. With that, I believe it's sufficient to open up and not have to wait till June 15, as Governor Newsom has stated. We should follow the science, which has caused us to be in lockdowns, and now that science will allow us to reopen and to flourish ever quickly. San Diego is known as America's fittest city, so we should continue pushing with that. Thank you for your time.
Thank you. Next speaker, please.
Hi, good morning. Just a few things. I'm a public employee, and I've been working my butt off this whole time. I don't understand why your staffers don't answer the phones in your offices.
I'm going to pause your time. If you could please state your name for the audio record.
Oh, sorry, Shayna Dunn.
Thank you.
I'm trying to understand. I can understand till December, but since January, your staffers should have been answering the phones. I've been working hard. I set up a Google Voice number. I had phone calls transferred from the families I work with. So I think it's about time. And I've started telemarketing and calling, and Nora Vargas's office was the only one who's answered the last few calls I've made to all 5 of your offices. Number 2, I was asked for my ID and an insurance card when I went to get my vaccine. I'm not asked for an ID when I vote. I find a problem with that. I did not want to present my ID, and since I gave my phone number, I've been getting solicitations from the specific spot that I got my immunization or vaccine. Third thing, why is Caltrans San Diego contracting out work to 5 Keys organization? That's what we pay the employees to do with Caltrans. We've got graffiti all over. I haven't driven downtown in a few weeks, but there was graffiti just over here on the east side of the airport. It's just all over. And we have 2 to 6 7-foot weeds all over. So why are our taxes going to pay a different organization when we pay the Caltrans employees to do that? That's it. Thank you.
Thank you. We will now hear from those that requested to speak by phone. We will be calling speakers by the last 4 digits of their phone number. You'll hear a notification that your call has been unmuted. You will then need to press *6 to unmute your phone. Each caller will be asked to state their name for the audio record, and you will have 2 minutes to address the board. I would remind the public speakers that they should mute their TV or live video stream before they begin speaking. And if you could please identify the first caller.
Our first caller is 7613. 7613.
Good morning, supervisors. My name is Becky Rapp. I'm a mother and a youth group mentor here to raise my concern regarding the county's potential expanding of the marijuana footprint into rural unincorporated areas. As an attendee of the Julian Planning Group, I would like to inform you of some of the grave concerns the locals have regarding how their community land is used. Julian is a small mountain town relying on outside tourism. They are known for great food, fresh mountain air, and year-round family-friendly activities. In 2016, Julian established a dark sky network after working with the county for several years to enact an outdoor lighting ordinance that met the high standards of the International Dark Sky Association. Allowing marijuana growers into Julian would be detrimental. According to reports, marijuana grows require a substantial amount of light. Large, heavy, bright light simulating the sun. This would be detrimental, negatively affecting the environment, including increasing energy use, damaging the ecosystem and wildlife, and harming humans. All contradictory to the board's priorities regarding climate change. In rural areas, increased energy use can also increase the risk of diesel spills and wildfires from generators, all things which are bad for Julian and the county. I would encourage you to protect Julian's dark skies and uphold the current marijuana ordinance. It's crucial that you recognize the negative impacts that will occur in rural unincorporated areas, as these communities will be devastated by the smallest of changes that are not thought out and well planned. No one is asking for marijuana. Listen to your constituents, not the pot industry. Thank you.
Thank you. Our next caller is 3640. 3640.
Hi, my name is David Garcias. I'm the president of SEIU Local 221. I want to take a minute and really thank the Board of Supervisors for this new direction you've established this year. As we are finally seeing signs of progress in the long fight against the COVID-19 pandemic, I'm encouraged by the action this board has taken to protect working families. Thank you for supporting pro-worker items, including the Office of Labor Standards, but there is still work to be done. Please tell county staff to finish the job and offer a fair agreement regarding hazard pay and a remote work stipend to county employees, and respect us, protect us, and pay us. Your county employees, your workforce, is asking you for your leadership on this item. Thank you.
Thank you. Our next caller is 1444. 1444. Please press *6 to unmute. One 444. Please press *6 to unmute.
Thank you. My name is Chris Wade. I'm here today to recommend and encourage the Board of Supervisors to watch the county's virtual news conference on Thursday from 10 to 11, titled Doctors Warn Cannabis Can Cause Serious Health Hazards. San Diego County Marijuana Initiative will introduce IASIC, the International Academy on the Science and Impact of Cannabis. At the news conference, 4 of the medical doctors will discuss current cannabis-related trends in emergency and other medical settings, and make available reliable, peer-reviewed medical resources on the short and long-term consequences of cannabis use. IASIC, the International Academy on the Science and Impact of Cannabis, is a medical organization of doctors who educate on marijuana-based scientific and medical literature. IASIC is a nonpartisan, non-political group created to facilitate informed decisions when considering cannabis policy and law. The news conference will be based on the review of the scientific evidence and concluded that the public health effects of high-potency cannabis are harmful. These growing negative impacts further strain healthcare and addiction treatment resources to the extent that they far surpass taxation revenues. This evidence-based information provided at the news conference should be thought-provoking to the board and should give you pause before you move forward with marijuana policies. Thank you.
Thank you. Our next caller is 4592. 4592. Please press star 6 to unmute. (4592). Please press star 6 to unmute.
Good morning, Board. Kathleen Lippett here. My background in biology and public health helps me appreciate that both will be irreparably harmed by turning over unincorporated communities to the marijuana industry to promote, sell, and profit from addiction. Sadly, the cannabis equity framework appears to be the result of a collaborative effort between the industry and politically ambitious public electeds, muting the public voice as well as the voice of supervisors responsible for unincorporated communities. The board asserts it recognizes the importance of Mental Health Month. Then why would they ignore the science that has documented that mental health is put at risk by the high THC products, especially for youth? That's not following science. That's giving in to marijuana influence. Further, the importance of drowning has also been mentioned. And I don't know how many of you remember the incident where the mother who was high on marijuana and unable to respond to her 2 toddlers ended up with 2 toddlers drowning in the pool. Parents who are high on marijuana also are not able to be responsible to take care of their own children. The ordinance undermines community priorities for clean air, water, safe roads, the environment, and quality of life. These are all being set aside to codify regulations to serve the marijuana industry. The industry's destructive environmental history is well documented. They've developed high-potency products to increase addiction. They've used smarmy, sweet, and fruity flavors to hook kids, targeted vulnerable communities and youth, and displaced insensitive uses and community-friendly businesses. They've diverted water resources to serve themselves.
Thank you.
Thank you.
Our next caller is 2813. 2813. Please press star 6 to unmute. 2813.
Hello, my name's Sandra Martinez, and I'm asking you to terminate the health emergency in San Diego County today. The health emergency is based upon faulty PCR testing, and here are the facts. Dr. Mullis, inventor of PCR testing, explicitly warned that PCR testing is not a diagnostic tool. In January 2021, the WHO stated most PCR assays are an aid for diagnosis in combination with clinical observation. PCR results have a high rate of false positives due to high cycle thresholds. Dr. Hodgkinson, chairman of a biotech company in North Carolina that sells COVID tests, says a positive PCR test result does not mean clinical infection unless there are presenting symptoms. In a study of 10 million people, there was not one case of asymptomatic transmission. Portugal, Germany, Holland, and Austria have all legally ruled that PCR tests are not suitable for COVID-19 diagnosis. Do the right thing for San Diego County. Stop this politically motivated health emergency now. Thank you.
Thank you. Our next caller is 7234. 7234. Please press star 6 to unmute.
Good morning. My name is Terry Ann Skelly. In honor of Asthma Awareness Month, I want to share my concern for secondhand tobacco and marijuana smoke and vapor in public spaces, and in multi-unit housing complexes where it's difficult to escape from secondhand smoke. This is definitely an equity issue since a large portion of financially challenged families and ethnically diverse individuals live in multi-unit housing, and children disproportionately live in these apartment complexes. These children are suffering from the health impacts of drifting tobacco and marijuana smoke, which precipitates asthma and other respiratory consequences, especially now while they must spend so much time at home. And of particular concern is that the exposure to secondhand marijuana smoke, which produces a detectable secondhand high for its victims, a contact high with detectable levels of THC, as determined in studies utilizing urine screening and blood tests. Children and other non-smokers exposed to marijuana secondhand smoke in a room without ventilation tested positive for THC for up to 3 hours following exposure. Marijuana's secondhand high effect is particularly troubling when considering the potential impact to children exposed to marijuana smoke. California Department of Public Health released an advisory that marijuana secondhand smoke is dangerous, containing many of the same cancer-causing chemicals and toxic chemicals as cigarette secondhand smoke. Since data from 2016, 2018, and 2020 indicate that marijuana secondhand smoke exposure is on the increase in California, there has never been a better time than now for the county in its quest to improve health inequities to recommend that all multi-unit housing have smoke-free, vape-free tobacco and marijuana restrictions in place, as does 65 other cities in California. The number of policies keeps increasing as the research continues to pour in regarding.
Our next caller is 1822. 1822, please press *6 to unmute.
Good morning, Supervisors. This is Peggy Walker. In light of Mental Health Month and in light of item 16 on today's agenda, I came to ask you, please, start by applying this excellent new policy-making method, item 16, to your marijuana proposal. You plan to invest $14.5 million in the comprehensive practice to prioritize high-quality research over anecdotes. Those words should be enough for you to insist on more quality research on marijuana before forcing it on constituents. The marijuana industry has been selling misconceptions and lies based on anecdotes, not science. But few, if any, policymakers take the time to research the science-based evidence of marijuana's harms. Supervisor Fletcher, you've said you know little about the impact of marijuana on teens, and now you have the opportunity to use this great new policy to conduct that research thoroughly. Marijuana is engineered to produce highly addictive and sometimes deadly THC content. Pediatricians and doctors are finally saying enough. There's a marijuana epidemic that's seriously harming youth, and we need to stop it. You can hear evidence on marijuana's harms on a new website, it was mentioned earlier, of the International Association on the Science and Impact of Cannabis, with over 15,000 articles written by medical professionals. Did you know that in addition to other harms, marijuana is linked to autism, that it changes male sperm DNA? Marijuana is a complicated issue that results in serious mental health issues. It deserves research and evidence-based policymaking because, as you said earlier, we care for each other. Thank you for your time.
Thank you. Our next caller is 3800. 3800, please press *6 to unmute.
Thank you. My name is Barbara Gordon. I'm here today to express my concern as the county considers allowing marijuana businesses in the backcountry. Responsible land use needs to be the county's priority. I've attended the Ramona Planning Group meetings, and what's important to them is road safety, neighborhood improvement, community character, traffic calming measures, pollution, loss of biological resources, and the depletion of limited groundwater resources. I haven't heard any community members ask for more marijuana businesses. Residents who live near the 3 marijuana businesses already feel uneasy with the expansion of this industry. The public deserves to know the real costs and consequences of these businesses, considering the many marijuana-related issues like drug-impaired speeding, distracted driving. Ramona has seen several very tragic car accidents recently, especially with their windy roads. Creating a recreational destination for marijuana is problematic, with one road in and one road out in Ramona. It's not equitable to compromise public safety and degrade the quality of life in order to benefit a relative few people. Public safety and health needs to be the priority, not promoting the marijuana industry's predatory practices. Thank you.
Thank you. Our next speaker is 6598. 6598. Please press *6 to unmute.
Good morning, Ann Riddle here. I attend the Fallbrook Planning Group, and I've been impressed by the discussion there as they look at the proposal of bringing marijuana businesses into their area. I have noted how divisive it is and complicated it is and confusing it is, but a particular concern is the impact it'll have on young people. I wanted to bring to you my experience as a social worker. When I first graduated from graduate school, I inherited a client list in foster care, the real unsung heroes, I might add. And I learned a lot from that experience with those teenagers. I learned that the problems that occur in adolescence and the behaviors that begin in the teen years are very difficult to rectify. So my concern is that no supposed marijuana taxes or grants will ever compensate for the negative consequences of promoting marijuana use by commercializing marijuana storefronts. I'm also concerned about the information regarding the extraordinary amount of marijuana money that can be very corrupting. It concerns me that money will take the precedence over the voice of the people. As you go forward with this marijuana proposition, I suggest that you carefully examine the potential and the impacts on young people and the challenge there is of preventing youth use. Many of us have beseeched the state's Bureau of Cannabis Control to do minor decoy operations regarding marijuana deliveries coming to young people. They have told us that is not in their purview, and they do not intend to do that. We need our county to care about our young people, and perhaps you could consider doing compliance checks on marijuana deliveries. It would be most welcome.
Thank you. Our next speaker will be 7159. 7159. Please press *6 to unmute. 7159.
Good morning. This is Mark Wilcox. On January 27th, when I zoomed in to hear the county's report on COVID, a grueling, primarily respiratory disease, following the county's COVID report, I found that the next agenda item was number 13 and entitled Framework for the Future, Saving Lives and Improving Health Outcome Through Comprehensive Harm Reduction Approach. Agenda 13 had been bumped to the front of the line ahead of other agenda items. This item turned out to be proposed by Mr. Fletcher regarding bringing marijuana businesses to the unincorporated areas when he does not represent any unincorporated areas. What we then heard as a staff report came straight off the website of NORML, the well-known pro-pot website. Well, these words are coming from a grandpa, father, and youth ministers. Minority communities do not want pot shops in their communities. Racial and ethnic minority groups experience higher rates of illness and death across a wide range of health conditions, including diabetes, hypertension, obesity, asthma, and heart disease, all exacerbated by smoking and vaping marijuana. Permitted pot shops do not stop the unpermitted black market, and data suggests just the opposite. Taxes received would never compensate for enforcement expenses and social costs. Further, we found out that this proposal has not been discussed with the county's planning groups, nor had county's planning groups ever mentioned they were interested. This proposal does not save lives or improve health outcomes. It is not collaborative or caring either. Thank you for your attention to addressing this very serious issue.
Thank you. Our next caller is 7872. 7872, please press *6 to unmute.
Hi, my name is Allison Hartman. I'm calling on behalf of Reopen San Diego. And I was calling to ask, you guys have been talking a lot about evidence-based policy, which we are all for evidence-based policy. But my question would be, if you're following the evidence, then why are you not allowing those people into meetings without a mask if they have a medical exemption or religious exemption? So basically, that is discrimination against disabled people and against people that cannot wear the mask. So my question to you would be, do the vaccines not work to protect people? Is the only thing that protects people a mask? Then why would people get a vaccine? Why does it matter if these people wear a mask if you've all been vaccinated? Why do you continue to wear a mask if you've been vaccinated? It almost looks like you are a bunch of anti-vaxxers who don't believe the vaccines work. As leaders of San Diego, is this the message you want to give? Also, why is San Diego not following the CDC guidance around masks? If you are doing evidence-based policy, why are you not following that evidence? So my next point would be Texas dropped their mask mandates 3 weeks ago and yesterday recorded 0 COVID deaths. Why are we not following that obvious evidence and dropping the mask mandates altogether? What is the point of waiting to June 15th? This is arbitrary, non-evidence-based policy, and the people of San Diego deserve better. Your obedience to arbitrary policy is prolonging this nightmare for everyone in San Diego, including and especially our most vulnerable and our children. So I'm asking you to please consider making your policies based on evidence like you say you are going to. Thank you.
Chair Fletcher, that concludes the request for non-agenda public communication this morning.
Thank you, and thank you to everyone who called in today. And I know there was considerable desire for folks to have the opportunity to come in person. A lot of energy behind that. We're thrilled to be able to move forward, and I want to thank both of the speakers who came down in person today. Next on our agenda is approval of the board meeting minute statement of proceedings for the meeting of May 4th, 2021, and the special meeting of April 26, 2021. Is there a motion for approval? Have a motion by Vice Chair Vargas. Is there a second?
Second.
Seconded by Supervisor Tara Lawson-Remer. Any comments or questions from members of the board? Ask the clerk to please call the roll.
Thank you, Chair Fletcher. Supervisor Anderson?
Aye.
Supervisor Lawson-Remer?
Aye.
Supervisor Desmond?
Aye.
Vice Chair Vargas?
Vargas, aye.
Chair Fletcher?
Fletcher, aye.
That motion passes unanimously with all supervisors being present and voting aye.
We'll now proceed with the formation of the consent calendar. We'll begin with the clerk. Ask if there's any items the public wishes to be pulled from today's consent calendar for discussion.
Thank you, Chair Fletcher. Item 1 has been pulled by the public. Item 5 has been pulled by the public. Item 10 has been continued to the June 8th Board of Supervisors meeting at the request of the Chief Administrative Officer. Item 13 has been withdrawn at the request of the Chief Administrative Officer. Item 15 is a presentation item. Item 16 has been pulled by the public. Item 19 has been pulled by the public. For item 26, I'll note for the record that in accordance with Government Code Sections 3511.1 and 54953C, a summary of the County Council salary and benefits is reported as follows. The annual salary for the County Council will be $286,850. The County Council will also receive a monthly vehicle allowance of $675. The county will contribute 2% of annual salary to the County Council's deferred compensation plan and will reimburse up to $15,000 in relocation costs. Indemnity is provided for acts or omissions in the performance of the County Council's duties. Consistent with other executive management employees of the County Council is eligible for health benefits, vision, dental, and comprehensive medical insurance. Other benefits include dependent life and long-term disability insurance, as well as workers' compensation. Paid time off includes holidays, sick time, and leave accruals for this on the same basis as other executive management employees with 15 or more years of experience. And a one-time 10-day initial accrual will count against accrual in the first year. Further benefits include a health reimbursement account, San Diego County Employees Retirement Association retirement benefits, tax-deferred savings plan. These benefits are set forth in the employment agreement that was previously before the board. With that note, that item may stay on consent. Item 30 has been pulled by the public. Item 31 are closed session matters that will be considered at the conclusion of the board's public session. And for item 1 on the in-home supportive services public authority, I'll note for the record that that item authorizes execution of an employment agreement, including salary and benefits between the public authority and its executive director. With that statement, this item may also go on consent. All the remaining on the Board of Supervisors agenda may be placed in the consent calendar for your board's consideration.
All right, we'll now go to Supervisor Anderson. Are there any items you wish pulled or comments that you wish to make? Supervisor Anderson.
I'm sorry, I'm still dealing with mute. I don't want to pull anything. I have nothing to add. I will make the motion for the consent item, for the consent calendar, if you wish.
Thank you. Thank you, Supervisor Anderson. We'll next go to Supervisor Wasson-Reamer.
No, thank you.
Supervisor Desmond.
I have no items to pull. However, I'll second the motion of Supervisor Anderson, and I'd like to make comments on item 18. I know I gave a proclamation earlier today for the drowning prevention opportunities for San Diego County and in the foundation, but I want to thank Supervisor Vargas for co-authoring this important board letter with me. In 2020, data showed that in the middle of the COVID-19 pandemic, more children in San Diego County were rescued after almost pool drownings in pools, beaches, and other bodies of water than in the past 5 years. In California, drowning is a leading cause of injury-related deaths among children under the age of 5. In 2019, 100 fatal and non-fatal drownings were treated at Rady's Children's Hospital, and 50% of the non-fatal drowning victims struggle with lifelong severe injuries. So according to the CDC, swimming lessons reduce drowning risk by 88%. But 4 out of 5 children in households with incomes of less than $50,000 a year have little to no swimming ability. Addressing this disparity in our region saves lives and helps address equity along with many of our communities by adding more opportunities for San Diego County children to learn basic drowning prevention skills. So today's recommendation directs the Chief Administrative Officer to work with partners focused on drowning prevention and develop a drowning prevention outreach campaign in collaboration with First 5 San Diego. Additionally, it'll support a grant for up to $250,000 to an organization that will administer the grant funds to license swim programs throughout San Diego County, including all the municipalities as well, to teach underserved children basic drowning prevention skills, swimming lessons, and here in San Diego County. So I understand this is part of the consent. I appreciate my colleagues' support for this item, and hopefully this will save many children's lives throughout our county. Thank you.
Thank you, Supervisor Desmond. Vice Chair Vargas.
Thank you, Chair Fletcher. I have a couple of items that I just want to, I'm happy to support this, but I want to make sure that I speak up on a couple of them. The first one is item number 6. I think that as I vote to accept these important funds, this is the one specifically about HIV and AIDS services funding sources. This was a really important initiative that we're going to be working on because I want to reflect on the people that it serves. It's nearly 20,000 people who are living with HIV and AIDS in San Diego County and who depend on these critical resources. With disparities in infection and treatment, our Black and Brown communities in particular need support. People living with HIV continue to experience stigma, which is a barrier to care. As allies, we all need to fight that stigma as a region and support our friends and family living with HIV, while encouraging and empowering those most vulnerable to get tested so that they know their status. Like with heart disease and diabetes, early detection is crucial because undetectable equals untransmittable, which means that people living with HIV who adhere to their prescribed medication regime have undetectable amounts of the virus and can no longer transmit HIV and live healthy lives. This is huge for our community and for our county. What is more, we have a revolutionary protective measure called PrEP and once daily pill that helps prevent HIV transmission. We need more access to these vital prevention resources, especially for our Black and Brown communities. We are already doing this work in San Diego County, and we need to continue this fight until we win. We need to fight stigma, test, treat, and protect, empower, and together we can end HIV in San Diego County. It's with that understanding that the RWTA Part A Minority AIDS Initiative funds can be used for outreach purposes, and I'm hoping that we're going to make sure that these outreach pieces look like and ensure that residents know about the services and resources available to them. That was item 6. And then on item 7, I do also want to express my support on this item. This is the Perinatal Equity Initiative funding and authorizing pursue future funding opportunities for perinatal health equity. As a former executive at Planned Parenthood, I had an opportunity to work on addressing perinatal care. And when we look at the data, we see that there continues to be poor health outcomes and inequities among our African American population in our county. I'm glad that this funding will be used to help advance equity and raising further awareness about maternal care. I continue to support the Black Legacy Now campaign, as well as support the Father to Children Fatherhood program. Ensuring equity for perinatal care is a priority that I feel really passionate about, and I'm happy to help spread the word about these programs and assist in any way necessary. Thank you again for all the work, and I'm happy to support this item. On item number 9, specifically on the competitive solution for security guard services, the county currently relies on a number of outside contracts to meet the demand for workforce services. As we continue to seek contracts that provide workforce to perform various duties for the county, I think it is important that we ensure that the contracted workforce is appropriately trained and meeting county standards. To do so, it's critical that we include language as part of the statement of work for RFP contracts to ensure that these requirements are properly addressed. It's my understanding that the Finance and Contracting subcommittees have been working on putting something together, and I look forward to seeing the outcome on that. In the meantime, I just wanted to emphasize that I think it's extremely important that we treat our outside contractors the same as we do, or better, our employers here at the county. And the last item is item number 18, and I want to thank Supervisor Demon for co-docketing this item with me. I wanted to make sure that I speak up on this issue because this issue is very near and dear to my heart, because when my angel mama was 15 years old, she was with her baby sister, who was about 9 years old at the time, and they were swimming at a beach in Rosarito. And there was a current that came in, and it came in really strong, and it took my aunt's life. She was a baby. She was 9 years old. I never got to meet her. The incident changed my mom's and our family's life, and for that reason, my mom ensured that my sisters and I took swimming lessons early on. I ended up competing swimming when I was a kid because of that. But as I continued to do work in our community, I realized that not many kids had the same opportunities or access to swimming lessons, pool, or beaches, including my own team. As we were working to prepare this item to docket it, we had real conversations about half of them don't know how to swim. And all of them grew up in South County. Some of them actually just learned how to swim last year or so. In this day and age, we still find that 60% of African American children don't know how to swim, as well as 45% of Latino children. Additionally, it's heartbreaking to know that 1 in 5 people that die from accidental drownings are children younger than 14 years. The summer months are ahead of us, and I'm really happy that we're going to be directing our Chief Administrative Officer to work with community organizations to develop water safety outreach campaigns. We're going to make sure that these resources are available for swimming lessons and drowning prevention skills. I think one of the most important things that we do as a county is that we are the safety net for the most vulnerable populations and communities. So enhancing these educational programs and drowning prevention for children is a must. So I am so grateful for my colleagues for supporting this. Y lo tengo que decir en español porque creo que es importante que para nosotros, especialmente en nuestras comunidades, no todo el mundo tiene acceso a albercas y menos al mar. Así que muchos de nuestras personas de nuestras comunidades de bajos recursos no tienen acceso. Para mí esta política pública es personal porque cuando mi mamá estaba chiquita, ella tenía una hermana, la cual se ahogó en una playa en Rosarito. Este incidente cambió la vida no solamente de mi mamá, pero de toda nuestra familia. Por este motivo, mi madre nos metió a clases de natación. Desde muy chiquitas, mis hermanas y mi hermano y yo, todos nadamos, ¿verdad? Durante mi trabajo en la comunidad me he dado cuenta que no todos los niños tienen la misma oportunidad y acceso a albercas, playas y clases de natación, incluyendo los mismos miembros de mi equipo de trabajo. Y mientras preparamos esta propuesta, platicábamos que la mitad del equipo no sabe nadar. Y todos crecimos en el sur del condado de San Diego. Algunos de ellos apenas aprendieron a nadar el año pasado. Esto es importante porque no nos debe de sorprender desafortunadamente que 64% de los niños afroamericanos no saben nadar y el 45% de los niños latinos tampoco pueden nadar. Eso tiene mucho que ver con acceso y oportunidades. Desafortunadamente, 1 de cada 5 personas que muere por ahogamiento es menor de 14 años. Así que debemos de pensar el impacto que tienen estas muertes y accidentes en nuestras comunidades y para los jovencitos y nuestras familias. El verano está muy cerca y como condado debemos hacer todo lo posible para la prevención de ahogamientos de niños. Por eso estamos recomendando al oficial administrativo que trabaje con las organizaciones de nuestra comunidad para desarrollar una campaña de prevención y no solamente eso, para proveer oportunidades para que nuestros niños puedan tener oportunidades a nadar, aprender a nadar y más que nada pues aprovechar de lo bonito de San Diego que son nuestras playas y las albercas. Así que con esto le pido a nuestros supervisores que voten por sí por esta propuesta. Muchas gracias. Thank you, Chair.
Thank you, Vice Chair Vargas. I have no items to pull. I want to echo the support of Agenda Item 6 on HIV/AIDS funding. I think this is a critical component and effort that our Health and Human Services Agency undertakes, and as a board, something we have to continue to do more and strive to work on. I also want to commend Supervisor Desmond and Vice Chair Vargas for bringing forward Agenda Item 18. I think this is a very important effort that we do as a county, and certainly one that is very real and has very long and permanent impacts on families, and do everything we can to address the issue of drowning, I think is vitally important in our region. And on item 7, I also want to echo my support of the Live Well San Diego vision efforts around tackling the disproportionality in perinatal health initiatives. We know mortality rates for Black infants are 3 times more likely to die than white infants. They're 60% more likely to be born premature. Black mothers are 3 times more likely to die because of pregnancy or delivery complications. As a board, we unanimously voted to declare racism a public health crisis, and we unanimously voted to take action to tackle issues of inequity in our healthcare system, and there is perhaps no greater or glaring inequity. And raising awareness of these issues and investing resources to tackle these issues is consistent with what this board unanimously directed our county staff to do. As a part of that effort, we launched our Black Legacy Now education and outreach campaign, and our public health department is working hard to address these issues, and I want to commend Dr. Wilma Wooten, our public health officer, for all of her actions, all that she is doing. I want to commend our community advocates like Planned Parenthood, ISDF, and so many others. The efforts we're doing around a doula program, a pilot program that we will be considering in the budget, I think are a part of many efforts and many fronts we can do to raise awareness of this issue and to see great progress being made. And so fully supportive of that item along with everything else that goes with it. With that, we have a motion by Supervisor Anderson, seconded by Supervisor Desmond for approval of the consent agenda. Before we call the roll, I'd like the clerk to confirm that the items for discussion today are items 1, 5, 15, 16, 19, and 30. And once we confirm that, please call the roll.
Thank you, Chair Fletcher. Yes, that confirms the items that are pulled. All the remaining items on the Board of Supervisors agenda, as well as the in-home supportive services public authority, are on the consent calendar. With that, Supervisor Anderson?
Aye.
Supervisor Lawson-Remer?
Aye.
Supervisor Desmond?
Aye.
Vice Chair Vargas?
Vargas, aye.
Chair Fletcher?
Fletcher, aye.
That motion passes unanimously with all supervisors being present and voting aye.
We're going to go first to Agenda Item 1 surrounding our Youth Transition Campus Phase 2 and 3. Before we go to our public speaker on this, I want to make some brief introductory comments. I am fully supportive of this item. In my State of the County address, I talked about prioritizing securing funding for the reconstruction and completion of our dilapidated juvenile hall Phase 2 and 3. We know as a board our effort and initiative is to divert youth from entering the juvenile justice system, and we are extending considerable energy and effort to achieve that aim. But we also know that we're faced with the reality that juveniles will always, despite the best efforts and intentions, find their way into our system. And when they do, we want to make sure that they have a campus that's designed for rehabilitation, for restoration, and to get them on a path to a better life. Shortly after I was elected, I visited the campus that the county has around these issues, and I saw the county's long-term plans for revamping juvenile camp and visited the construction site that was underway. and learned about the trauma-informed design of the educational, recreational, and residential spaces, but also how all the changes that we are making in staffing and in programs and in trauma-informed care and around use of force, all of those efforts and programs are not going to reach their full potential if we do not complete the youth transition campus. I also don't believe this is an issue that we can wait 5 or 10 years to do, and there's an opportunity to move forward now. Phase 1, which is making tremendous progress, is adjacent to our current juvenile hall. And if you have the opportunity to visit that, you will be struck by the concertina wire, the locked cells, the lack of trees or outdoor space. Frankly, I found it an environment more intimidating than that in which I held high-value al-Qaeda detainees in the war on terror. That is not the environment we want the youth of San Diego County in. And the combination of phase 1, 2, and 3 give us the opportunity to truly complete the vision of what we're trying to do around juvenile justice. And I vowed at that point, visiting those, to do everything I could to see us expedite, and I am very pleased to see the full funding for these phases included in our proposed FY 21-22 budget. I'm hopeful that we can move quickly on these. I'm also grateful that Balfour Beatty was the only company that responded to the RSFQ to complete phase 2 and 3. They're already on site building phase 1, so we can achieve efficiencies both on timeline and on cost by accelerating and moving forward with what we are doing. I also appreciate their commitment to a skilled and trained workforce, prevailing wage, and other things that we know are essential to the construction of project. These new buildings will be environmentally friendly by achieving a LEED Gold certification and attempt a 0 net energy rating based upon design and architectural features. And again, we are focused and driven to try and divert youth away from the juvenile justice system by providing services in the community. But we know that some individuals will come in, and when that happens, it is incumbent upon us to create a therapeutic and rehabilitative environment for their stay, to ensure that we can help give them every chance of back on track and a productive life. And I think this campus is critical to those efforts, and I urge our support. I know our staff is on hand if there are any questions. Let me ask first if we have any public speakers on this item.
Thank you, Chair Fletcher. Yes, we have one request to speak in person and one request to speak by phone. Would you like to hear from those callers?
Please.
We'll call forward the speaker in person. I'd like to invite forward Dr. Robert Newman. Dr. Newman, could please come to the podium, entering from the hallway on the 3rd floor. While we're waiting for that speaker, we can also go ahead and hear from the speaker that has requested to speak to us by phone. And if you could please identify that caller.
Caller 2153, please press *6 to unmute.
And you'll have 2 minutes to address the board, and please begin by stating your name for the audio record.
Good morning, supervisors. This is Kelly McCormick, and I run a youth mentoring program. I'm a resident of District 5. My comment regards changes to the County Probation Department regarding the way it handles cases involving justice-involved youth and their families. More than $205 million will be spent on a youth transition campus, and there's been extensive consultation with national experts in juvenile justice reform. The stated goals are to support juvenile correctional agencies with transitioning to a positive youth development model of juvenile detention and to ensure the project results in positive outcomes for youth and staff. These are laudable efforts. I also ask that you consider the effect that marijuana use has on teenage arrestees and the impact of normalizing and commercializing its use. A report from the Sandag Criminal Justice Clearinghouse looked at 20 years of data involving substance use by those under 18. The majority identified marijuana as their drug of choice. 57% of juvenile arrestees tested positive for pot, and 58% reported that it was the first drug they had tried, and 73% had vaped high THC concentrates. Science is clear that marijuana use by youth results in worse problem-solving skills, less control of emotions, and lower academic performance, among other negative outcomes. Marijuana is also associated with higher use of other drugs. If these justice-involved teens had never tried marijuana, would they have made different decisions? Perhaps they would not have been justice-involved at all. Efforts to prevent youth marijuana use could be one of the best ways to have a positive outcome for justice-involved youth and their families. Thank you.
Thank you. We'll now go to the speaker that requested to address the board in person, Dr. Newman.
Hello. 2 minutes. I'm Dr. Newman. I'm glad to be here to exercise my liberties. I want to request that you remember July 16, 1969. I'm a candidate for governor here in California in the recall election. I've been here all my life. I grew up in Lakeside. The reference to this date, July 16, 1969, is the birth of my son. He was the bicentennial baby of the city of San Diego. He was quite a celebrity. Robert Carver Newman III. I'm Robert Carver Newman II. I am a research clinical psychologist. All my education through the doctorate was in the San Diego area. I appreciate your attentiveness. I see you're focusing on me, and I very much appreciate that as I am focused on you. I want to emphasize, be responsible for your decisions, make your decisions. Don't just follow the local health officer, the state health officer, the federal health officer. Listen to what they have to say. Do your own research. Reach a reasoned decision about how to treat your constituents, the people of San Diego County. God bless. I'm Robert Newman, candidate for governor, recall election.
And that concludes public testimony in this item, Chair Fletcher.
All right, thank you. With that, I'll make a motion for the approval of the recommendations in agenda item 1. Is there a second or any discussion? Second. We have a second by Vice Chair Vargas. Let me ask my colleagues if there's any comments or questions they wish to make. All right, hearing none, we have a motion by myself, seconded by Vice Chair Vargas. Ask the clerk to please call the roll.
Thank you. Supervisor Anderson.
Aye.
Supervisor Lawson-Remer.
Aye.
Supervisor Desmond.
Aye.
Vice Chair Vargas.
Vargas, aye.
Chair Fletcher.
Fletcher, aye.
That motion passes unanimously with all supervisors being present and voting aye.
We're now going to move to agenda item 5, our COVID updates. We will first get a presentation from our Health and Human Services and COVID response team. Then we'll go to our public speakers on this item and return to the board for deliberation. We will give the staff a moment to get situated, and then they can begin their presentation.
While the staff are getting situated, any members of the public that requested to speak on this item by phone, please dial into the conference line now using the instructions that were provided to you. You will be muted until it is your turn to speak. Thank you.
Chair Fletcher, members of the board, today's presentation will feature Dr. Wilma Wooten, who will provide a public health update. Then we'll hear from Nick Mascione, our agency director and head of T3, for an update on the vaccination efforts underway throughout the county, as well as an update on outreach, education, and communication efforts. Finally, Andy Pease, our Incident Command Finance Chief, will provide finance update and information on ARPA guidance. Without further ado, I'll welcome Dr. Wooten.
Thank you, Don. Good morning, Chair Fletcher and members of the board. This slide shows the epidemiology curve for COVID-19 cases by onset of illness and provides a historical overview to date, including key milestones related to health officers' orders, state actions, and county tier status. Since the regional stay-at-home order was lifted by the state on January 25th, and with continued vaccinations now over 3.34 million, daily cases by illness onset have continued to decline. In a close-up view from January 1 through May 16th, daily case counts by date reported have also continued to wane. In the 14-day period from May 3rd through May 16th, daily case counts primarily have been below 250 except one day. And on May 11th, we saw less than 100 cases for the first time since May 31st last year. This table provides a summary of cumulative cases with a breakdown by age, gender, hospitalizations, ICU admissions, and deaths. These numbers are through 11:59 p.m. Sunday, May 16th, which shows a total of 279,145 positive COVID-19 cases reported. The age range of all cases is from 0 to 108 years of age, with a median age of 35. The 20 to 49-year-old age group continues to comprise just over 54% of all cases, or 151,749 of the total number of cases. Gender remains unchanged. Hospitalizations make up 5.5%, or 15,351 of total cases. Of these hospitalizations, individuals over the age of 50 comprise approximately 74%, or 11,384 of hospitalizations. Furthermore, 1,696 of those hospitalized have been admitted to the ICU. These numbers are also decreasing and make up approximately 0.6% of the total number of cases and 11% of the total number of those hospitalized. The total number of cases also includes 3,742 deaths, or 1.3% of all cases. The age range for this group is 10 to 106 years of age, and the median age is 77 years. And all of these data and more information can be found on the county's website at www.coronavirus-sd.com. Now, looking at the trends for hospitalizations and ICU admissions, the next 6 slides share the percentage decrease for the past 30, 14, and 7 days. This figure shows the status of San Diego County's non-federal adult and pediatric hospital beds. In the past 30 days from April 16th to May 16th, from April 17th to May 16th, hospital census data show a decreasing trend of 31%. In the past 14 days from May 3rd through May 16th, hospital census data show a decreasing trend of 23%. And in the 7-day period from May 10 through May 16th, hospital census data show a decreasing trend of 22%. Now for ICU admissions in the past 30 days from April 16th through May 16th, April 17th to May 16th, ICU census data show a decreasing trend of 31%, which is the same as hospitalizations for the same time period. And for the last 14-day period from May 3rd through May 16th, ICU census decreased by 8%. And lastly, in the last 7-day period from May 10 through May 16, ICU census decreased by 14%. This is indeed great news, as 2 weeks ago, this metric was slightly trending upward. Now moving to information regarding our triggers dashboard. This dashboard monitors 3 areas focused on epidemiology or surveillance, healthcare or hospital capacity, and public health or overall response to COVID-19. Currently, only one of the 13 triggers on this dashboard continues to exceed its threshold, and this is community outbreaks. Currently, there have been 9 outbreaks in the past 7-day period, which is indeed more good news. At the last report, there were 18 outbreaks in the past 7 days. Now, since community outbreaks continue to be the only metric with an elevated threshold on the triggers dashboard, I would like to briefly provide a more in-depth summary of all outbreaks including community outbreak data. This table provides a summary of outbreaks broken down by settings, associated cases, and related deaths. These numbers are through 11:59 Sunday, May 16th, which shows a current total of 76 active outbreaks and 1,981 inactive outbreaks. The 3 outbreak settings include skilled nursing facilities with 6 active outbreaks, non-skilled nursing facility or congregate settings also with 6 active outbreaks, and community settings with 64 active outbreaks. SNFs and other long-term care facilities are seeing a decline in outbreaks due to increased vaccination of staff members and residents. In total, the 3 settings comprise 10.1% of the cumulative cases, and the SNF and long-term care facilities comprise approximately 28.8% or 1,078 of all deaths. Teasing out community setting outbreaks, a total of 1,525 outbreaks comprised almost 4% or 10,809 cases and 0.9% or 35 deaths. Moving to this next slide, further reviewing confirmed community setting outbreaks by month, November and December of last year recorded the highest number of outbreaks and associated cases. Confirmed community outbreaks have drastically decreased again, with only 9 outbreaks reported in the past 7-day period. Now, reviewing community outbreaks by settings, businesses continue to have the highest confirmed outbreaks at 639, and this is cumulative for the entire pandemic. Restaurants and restaurant/bars are second with 252 outbreaks, followed by third place, or the third group as groceries and retails with 109 outbreaks, preschools with 90, and healthcare with 79 outbreaks. The state is currently operating on the Blueprint for a Safer Economy framework, but as we have been informed, the plan to move to beyond the Blueprint is scheduled for June 15th. Statewide transmission of COVID-19 is decreasing. Currently, as of Monday, May 17th, 0 counties are in the purple tier, which is widespread transmission. 11 are in the red tier, which is substantial transmission. 38 are in the orange tier, which is moderate transmission, and where San Diego resides. And 9 counties are in the yellow tier, which represents minimal transmission for COVID-19. These numbers will change today with the release of the state's new metric report. As we wait for the state to post this week's metrics, we are showing metrics based on calculations by our county staff on this slide. For San Diego County, the unadjusted and the adjusted case rates for May 2nd through May 8th after a 7-day lag is 3.8, which remains in the orange tier. State metrics will be released publicly at noon today and may slightly vary. Now, the declining COVID-19 daily case counts is certainly great news. Nonetheless, the detection of COVID-19 variants continues to be a public health threat and is being closely monitored. Notably, because San Diego County has been at the forefront of extensive collaborations and local laboratory, with our local laboratory partners, San Diego has one of the highest number of whole genome sequencing reported in the United States. 7 variants have been found in San Diego County: the UK, the Brazilian, the 2 West Coast variants, the South African variant, and now the New York and India variants. The UK variant, or B117, is the most reported. As of Monday, May 17th, in San Diego County, 1,236 confirmed cases have been reported, which is 463 more cases than reported to your board 2 weeks ago. Of these total cases, there have been 25 hospitalizations, 10 additional since the last board report, and 2 unfortunate deaths, 1 additional since the last report to your board. The median age is 33 years, and the age range is 0 to 93 years of age. 52.7% are female, and 47.3% are males. Regarding other variants, 918 cases of the 2 coast variants. B1427, 339 cases, and B1429, 579 cases have been reported. 120 cases of the P1 or Brazilian variant reported. This is 57 more cases than reported to your board previously. To date, 3 cases of the South African variant have been reported locally. On Thursday, April 29th, there were 2 new variants identified in San Diego. The B1526.1, better known as the New York variant, and the B1617, better known as the India variant. No additional cases have since been reported. Now, in closing, as cases are declining and more people are vaccinated, we are extremely encouraged. We continue to encourage all San Diegans to follow all preventive measures as we are still in the orange tier. Until June 15th, CDPH will continue to keep the existing guidance in place related to facial coverings. On June 15th, California plans to implement CDC's guidelines for masking to allow fully vaccinated Californians to go without a mask in most indoor settings. This next 4-week period will give local jurisdictions time to prepare for this change while continuing to be laser focused on delivering vaccines to those eligible populations, particularly in underserved communities. As of May 3rd, facial coverings were no longer required outdoors except in crowded events, and for unvaccinated individuals when physically distancing could not be maintained. For indoor settings outside of one's home, including public transportation and schools, face coverings continue to be required regardless of vaccination status. However, until June 15th, when California plans to fully reopen the economy, California will keep the existing guidance around masks in place. As recommended, still wash your hands, watch your distance, and wear your mask. If you're sick, isolate yourself at home and get tested as soon as possible. And when it is your turn to receive the COVID-19 vaccine, which it is now everyone's turn, 12 years of age and older, get vaccinated. Vaccinations continue to be an important tool in controlling this pandemic and ensuring full economic recovery. Last week, 12 to 15-year-old youth became eligible to receive vaccinations, allowing light at the end of the tunnel to become even brighter. Thank you to everyone for your continued vigilance to help San Diegans be COVID safe. Now please welcome Agency Director Nick Mascione.
Thank you, Dr. Wooten. Since we last presented to your board, we reached a significant point in vaccine rollout. The U.S. Food and Drug Administration expanded the emergency use authorization for the Pfizer COVID-19 vaccine to include the 12 to 15-year-olds. And as of May 13th, we began vaccinating for the nearly 176,000 adolescents 12 to 15 years of age in our county. And anticipating of this milestone, we have ensured that the Pfizer vaccine is available at all of our county vac sites. This includes our mobile sites, which now carry both the Johnson & Johnson and the Pfizer vaccine. Vaccines are available for this age group by appointments using MyTurn or non-appointment drop-ins. Parental consent is required and may be provided in person at the vaccination site or given in advance by scheduling appointments on MyTurn and bringing the consent form for minors that can be found on our county website. We know that our county hosted and partner sites are just one place where parents and legal guardians may go to get their kids vaccinated. Many will go back to their pediatricians, whether that be at a federally qualified health center, a medical private office, or through a healthcare system. or they may choose to go to their trusted local pharmacy. Regardless of where they choose to go, our county vaccination ecosystem was built to meet the needs of adolescent vaccinations, and we continue to enhance new ways to helping our kids get vaccinated. Schools are one of those new ways and most trusted community hubs for families. Partners like UCSD and Sharp Healthcare are working closely with the San Diego Unified School District to provide vaccinations to various campuses. Operation Collaboration is also offering public vaccination sites at schools in our north and east rural communities. Our county has had a public vaccination site at Mara Vista High School in Imperial Beach since February 9th. And we recently established a partnership with Vista Unified School District in the city of Vista and other school campuses that will also open to the public. Being equipped to provide vaccine to this new group means having enough vaccine on hand. And as you can see, the overall supply has been increasing over the past several months. We are confident that we have the supplies regionally to ensure vaccinations for all of the newly eligible youth and remaining adults. Now, clearly, as you can see from this map, we're in a place of strong supply and many access points. Vaccinations are happening countywide thanks to over 500 locations, which include super stations, pharmacies, county and other partner and provider locations, mobile and school sites. One particular effort we're focusing on is increasing our mobile vaccination efforts to bring vaccines to where people live, work, shop, play, and pray. On May 12th, we launched the mobile vaccination request form on our county website, where organizations like businesses, community-based organizations, faith-based organizations, and others can request to host a public, no-cost vaccination event. To date, we have received over 100 such requests. This community excitement is promising, and we're working with the Black Nurses Association and Champions for Health to review the requests and set up mobile vaccination events. And while we may not be able to meet every single request, many are already scheduled. Over the next 2 weeks, our mobile teams are committed to 7 events, with more in the works, including a partnership with the San Diego Padres and Biocom. With the addition of the 12 to 15-year-olds eligible for vaccinations and the state now using 2021 population data, we adjusted our eligible and goal populations. As you can see in the table on the screen, San Diego's county overall population decreased between the year 2020 and 2021 population estimates. So even with the addition of the approximately 176,000 12 to 15-year-olds, the total eligible population only increased by about 113,000. We still maintain the goal of vaccinating 75% of the total eligible population, which now equals approximately 2.1 million San Diegans. Even with the adjustments on the eligible population numbers, I am very proud to share that nearly 86% of our goal population has received at least a first dose, and approximately and approaching 65% of our goal population is fully vaccinated. These numbers represent more than just progress to a goal. They are the result of so many coordinated efforts by our fearless County T3 team, our many community partners to ensure equitable access to the vaccine, including the culturally appropriate education and outreach conducted by our community health workers, or promotoras, in Project SAVE, Operation Collaboration's rural-focused vaccination sites and efforts to vaccinate agricultural workers in North and East counties, the partnership with multiple partners to vaccinate over 760 homebound San Diegans. And these are just a few examples. With the success of our pilot projects in the South region, we began implementing those interventions region-wide with a particular focus on increasing vaccinations in the North and East regions of our county that were trailing a little behind. Today, there are more than 3 times the number of people vaccinated in East County as compared to the month of March. And there are nearly 4 times the number of people vaccinated in North County as compared to the month of March. Now, we still have a lot of work to do, and we're proud of how far we've come. Our vaccination ecosystem is a testament to our trust in innovative and inclusive equity-based partnerships that have led to steadily increasing vaccination rates. And as you can see in the chart, when rated per capita doses given, San Diego County still is performing at the top of Southern California counties. In fact, we've been first position all along. And this is including the added 12 to 15-year-old data. Now, looking ahead, we're doubling down on our promotional efforts to inform the community. Again, supply of COVID-19 vaccines remains steady. Vaccinations are quick, safe, and easy, and available to every 12 and older at no cost in our county. As part of this, we're working with 211 to share information through push notifications and concentrating on communities within our health equity zip code areas and factoring in newly eligible populations, obviously, of our 12 to 15-year-olds. We've just completed our second vaccine willingness survey, and we'll be using it to inform all these efforts and more to ensure that we continue to remain relevant, address key concerns and questions from our community, and work toward meeting our goal as soon as possible. And we will be launching a youth-led contest soon to hear directly from San Diego County's youth and continue to raise awareness about the importance in getting vaccinated. While we and our partners are moving full steam ahead with these efforts, we cannot do it alone. As noted by Dr. Wooten, we need all San Diegans to come together as a community to spread the news about vaccine availability, its safety, and resources. With their help, we can protect those unable to get the vaccine and help us all get back to the things we love to do. So we ask, if you are fully vaccinated, help a family member, a friend, or a neighbor find a convenient location and get vaccinated. With that, I'll turn it over now to Andy Pease for the finance update.
All right. Thank you, Nick, and good morning. We have some noteworthy updates since our last report out on May 4th. First is that our weekly spend is currently trending around $10 million a week, which is about $1.8 million less than even just a few weeks ago. Now, the Great Plates program, the COVID income stipend programs, and our general COVID response costs, they remain fairly constant. It's in our testing and our vaccination costs and those activities that we're starting to see somewhat of a downward trend in the spending. And it's not too surprising based on what we just heard, tied to the general trajectory of the virus and as the behavior of the community adapts. Now, last week, we were notified that we would be getting an additional $38.7 million of emergency rental assistance program, or ERAP, funding from the federal government under the American Rescue Plan Act. This is in addition to, or on top of, the $107 million we've already been allocated, and we anticipate that there could be additional ERAP funding coming to the county from the federal government. We're currently reviewing the program requirements tied to this funding. It looks like it's a little broader than the current ERAP program, but similar in a lot of ways. And we'll be providing an update once we've completed that analysis and received that funding. Now, speaking of the American Rescue Plan Act, or ARPA, for our own ARPA Local Fiscal Recovery Fund allocation, we now have the official amount for the County of San Diego at $648.4 million, and that's about $900,000 higher than we anticipated, so that's very good news. And we expect to receive about half of those dollars, or $324 million, any day now. And as a reminder, we get the first half up front, and then we have to wait at least a year for the second half. And other good news is with the May revise and other federal funding, we anticipate additional stimulus and support funding coming to the County of San Diego in the weeks to come. Also good news is we finally received what we've been waiting for, and that's the ARPA guidelines on the use of these funds, so I'd like to take a moment to just talk about that. On May 10th, the U.S. Treasury issued what we call guidelines, or what I call guidelines, but it's officially referred to as the interim final rule, and that provides guidance on the use of these funds. First, I should note that these guidelines, or the interim final rule, they can change. They are not yet final. The U.S. Treasury is seeking input from the public on the guidelines before they finalize. Comments are due by July 9th, which means these rules will not be complete until mid-July or later July at the earliest. These guidelines in their current state are 151 pages. There's a lot to unpack and review, and that's what we're doing now, and working with our associations and understanding. I will say there's some bad news, good news, as it pertains to the timing and the use of these funds. First, the bad news. The interim final rule states that March 3rd of 2021 is the beginning point for when costs can be covered. That means the costs that we incurred in January and February of this year would not technically be eligible for ARPA funding. and that's unfortunate because you're aware we've incurred significant costs during those months. We will be submitting input to the U.S. Treasury challenging this beginning date, and we're going to make the argument that those costs should be covered earlier than March. But again, we may not know until sometime in July or later if the timing will change. There is some good news with the timing as well. You've known we've had until December 31st of 2024 to spend the ARPA funds. So that's about 3.5 years from now. But the U.S. Treasury defines spend as obligated, which in essence buys us a little more time, because obligated simply means the dollars need to be committed to a project, needs to be encumbered. The project needs to be stood up, but it does not necessarily have to be fully expensed. So the U.S. Treasury is allowing us until December 31st of 2026 for all of our ARPA local recovery funds to be actually spent, which is 5.5 years from now. It is in recognition that some projects, in particular infrastructure investments, take years to complete. This does not mean that we want to wait that long to spend these dollars, of course, but it does afford us some time to strategically leverage these funds for maximum and collective impact. Some additional good news is that the interim guidelines appear, for the most part, to align and complement the ARPA framework that you approved in concept on April 6th, which is shown on the slide before you. The guidelines specifically reference the use of ARPA for things such as our COVID mitigation and containment efforts. They use words like testing, tracing, treating, vaccination efforts. It references investments in food assistance, behavioral health, small business grants, direct payments to individuals and families, premium pay for essential workers, investments in childcare, investments to address homelessness and other impacted populations, investments in infrastructure, including broadband, stormwater, investments in rental assistance and legal assistance. And these are all components that you have put together in concept. I will note that there are two areas that in the first look at the guidelines does not seem to support funding for, and that is for any telework stipends, nor does it appear to include covering fee waivers. But we're still unpacking that and still looking at that, and when we come back June 8th, we'll have more on that, because again, the devil is in those 151-page details. So it is our intent to return at the next board hearing on June 8th with further information and details on the ARPA framework, incorporating the guidance and the input provided by this board, and it will include recommendations to establish appropriations for this current year as well as future costs. And at this point, I'll now turn it back over to Don.
Thanks, Andy. In addition to receiving the update, we recommend your board take the following actions with respect to this item. First, ratify all actions taken in response to the local health emergency and local emergency, including the contracts for community health worker services with the entities listed in Attachment A. If approved, funding sources for this request are anticipated to be federal and/or state stimulus funds. And finally, take any other actions necessary to address the COVID-19 pandemic emergency response. And subject to your questions, this concludes our presentation.
Thank you, Don. Before we go to board member deliberation and discussion, why don't we hear from our speakers? We'll start with those who are in person with us today, and then we'll go to our phone-in callers, and then we'll return to the board.
Thank you, Chair Fletcher. We have 20 requests to speak on this item, 10 in person and 10 requesting to speak by phone. Also know for the record that we received 44 e-comments on this item. Any members of the public that requested to speak on this item by phone, please dial into the conference line now using the instructions that were provided to you. As the chair mentioned, we will begin with the in-person speakers, those in opposition of this item. When I call your name, please line up on the physical distancing stickers in the hallway outside of the board chamber on the 3rd floor and enter the chamber one at a time to address the board at the podium. I'd like to invite forward the following individuals: Trent McClure, Richard Van Every, Mara Barr, Naomi Soraya, and Amber Mayo. All speakers will have 2 minutes to address the board, and we'll ask you to please begin by stating your name for the audio record. If I've called your name, you can come forward in any order. Again, that's Trent McClure, Richard Van Every, Mara Barr, Naomi Soraya, and Amber Mayo. And again, please state your name for the audio record.
Hello, my name is Trent McClure. I'm a resident of San Diego and a father and husband. I'm here to speak on behalf of those who cannot get vaccines. Part of the actions listed on this agenda item are to authorize any other action necessary to address the pandemic. I laud this board and this body for the seriousness with which you have considered the pandemic. Because there has been much talk circulating about vaccine passports, I felt compelled to come speak against such actions. In my family, there are multiple people who are immunocompromised and will not be able to get the vaccine. Beyond that, there are people who object to the vaccine with concerns over the thousands, yes, thousands, of deaths from the vaccine that have been largely ignored by the major media. Supervisors, regardless of how you feel or don't feel about the vaccine, allowing vaccine passports to move forward is nothing short of sanctioned segregation. Historically, this kind of action is the first step toward dehumanizing people, specifically the claim or fear that they carry different diseases. It was done by Nazis. It was done by our own country against people of color. It was done by the Hutus toward the Tutsis in Rwanda. And I can go on. We are not those people, and I do not bring these histories up to compare this body or any government body to those, nor to villainize this board. Indeed, quite the opposite. I have great faith in this body.
Thank you, sir. If you can please exit out the rear of the chamber. Thank you. Next speaker, please.
Hello, my name is Naomi Soria. I'm a San Diego native and a medical freedom activist and a mother of 2 beautiful children. I'm here today to bring a few matters that have been on my mind to your attention. Last year when the lockdown started, many people lost their businesses. Our elderly were put away into isolation. Children lost their right to a basic education. We lost homeschool funding. There was legislation passed that hurt homeschooling children by removing funding, which also affected children who are medically exempt from vaccines by putting SB 276 into effect, therefore removing their medical exemptions and doctor-patient privilege and their ability to attend public school. Education is an inherent right. You know what also is an inherent right? Breathing freely without a cloth over your face. Children have the right to not have their airways restricted, especially while learning. Our children lost 1 year of their life, 1 year of smiles, 1 year of warmth, hugs, security, and trust. This pandemic has gone from science-based to politically motivated overnight at the expense of the most vulnerable, our children and our elders. The government has gone so far as to remove the right to attend church and exercise our right to freedom of speech and freedom of religion. Where were the Board of Supervisors when this was happening? Why have they not been advocating for we the people? I have many questions today, but mostly I want to leave you with this. The Declaration of Independence says that we have the right to overthrow the government. The Declaration of Independence says that we not only have the right, but we also have the duty to alter or abolish any government that does not secure our unalienable rights, including life, liberty, and the pursuit of happiness. Our unalienable rights are in jeopardy right now. The pursuit of happiness is under attack. Life and liberty are damn near dead. Did you know that vaccines are exempt from liability? Who are we going to sue when our children become maimed and injured? These are the questions that I have today. Thank you.
Thank you. If you could please exit out the rear of the chamber. And next speaker, please.
Hi, I'm Mara Barr, and I'm a San Diego resident. I'm here to request that the Board of Supervisor declare the emergency ended immediately. The state emergency can only last 60 days. The county health advisor can only declare an emergency for 7 days. Both those deadlines have been passed a long time ago. Further, I request that you rescind the moratorium on evictions. I'm a homeowner and have tenants that I have allowed to live at my house, and they are harassing me because they know they cannot be evicted. They have moved more people in, and no, they're white people, so it's not about Hispanics. And they're called them guests. They refuse to leave because they have been emboldened by your policies. They are not paying rent, but they are getting government money. They have plenty of money. Your policies have emboldened their bombastic and terroristic behavior because they are taunting me, they are bullying the neighbors, their dogs are biting people. I have gone to court. The courts are closed because you've closed the courts. And that, so it's taking all this time while they continue to taunt me. And on my own property, they're disturbing my peace, coming at all hours of the day, calling me terrible names and causing danger to me and my animals. Because of this ridiculous and bogus health emergency that's taken away my rights as a homeowner, these tenants are terrorizing me. They are not getting money. They're not giving me money, but they're getting money from the government. So what I would say is also I wanted to address what Supervisor Vargas said about her aunt that died at 9 years old, and she said in her same statement about how abortion was health care. Death is always a tragedy. Children's death are always a tragedy. Abortion is not health care. It is killing a child. Thank you.
As the next speaker is coming forward, I will call the remaining speakers in opposition. Marie Pineda, Erica Marine, Joy Freeman, Aria Morgan, and Mike Stevens. If you could please line up on the third floor on the physical distancing stickers outside the board chamber. Thank you.
All right, my name is Amber Mayo. I am a Navy wife and homeschooling mother of 6. I love this place very much. And although I approve of tracking COVID, I cannot ever approve of just rubber stamping any and all action that could sacrifice, that will continue to sacrifice our rights. Let me show you why. Look at these charts. These are graphs of different geographic locations in the United States, all of them grouped together, but following different COVID policies. Can you tell, just by looking at them, which ones had harder lockdowns and which ones did not? Which ones followed the experts' advice more strongly than others? You can't. Human action made no significant difference. Our rights were only taken away. Our suffering was made so much worse, and it did no good that can possibly be measured. We just pretend that we could play God. My temple is held hostage. I love my God, and I want to help save my ancestors, and I can't because it's being held hostage for no good. I've had friends who have died, and I have had people who have lost their education, their loved ones, their family, their friends, their marriages, suicide, and it did absolutely no good because all this lockdown did is make the COVID harder to cope with. The Constitution of California only says that in a crisis, we could only increase funds so that people could deal with the crisis. No lockdowns, no restricting rights. We need our rights so that we have the liberty and the ability to handle crises when they come.
Thank you. Next speaker, please.
Thank you.
And ma'am, if you could please exit out the rear of the chamber. Thank you.
My name is Rich Van Every. I'm a 45-year-old resident of North County. And as you can tell by my hat, I'm a free thinker. It makes me wonder how open your mind is to continuing to accept this unjust information that is degrading this country. And I implore you to stand up for what's right. This is not okay. Quit pretending it's okay. The numbers are false. The testing is false. Yes, we're dealing with a bioweapon, but continuing to bring insult to injury is not okay. And I really, really hope that you either step down or find a new job or do something to stand up for what's right, because we are counting on you. This is a road to absolute communism. And I am frankly shaking about it. And we're not going away. I'm here as a representative of Reopen San Diego and LetThemBreathe.org. I'm not a parent, but every time I see a child with a mask on, it breaks my heart. It is absolute child abuse. There is zero justification for it. Thank you for paying attention. Next is the fact that I got to work on Plandemic. I don't know if you guys ever watched that film, but it's fascinating, and it's based in truth. You can find it at plandemicseries.org. Plandemicseries.com, sorry. It's there for free. Continue to get educated. Continue to stand for what's right. This is America. This is not China.
Next speaker, please.
Hello, thank you so much for taking our comments today. I appreciate your time. My name is Aria Morgan. I'm here with Reopen San Diego. I'm a parent. I'm also a former, I was born in a communist country. Came from the Soviet Union. And what I see here, I know many of you will disregard it, but we are slowly inching our way towards complete governmental control. I believe we still live in the greatest country on earth. I really do. I'd like to keep it that way. One of my main concerns today is the vaccine mandates and the mask mandates that are being implemented and encouraged, if not forced, soon upon our young children. We know that kids have a 99.997% survival rate. I'll repeat that, 99.997. They are not at risk, ladies and gentlemen. We also know that children act as a buffer. We don't know why, but they act as a buffer. For some reason, they do not spread the disease. You can look at these statistics. It's in the United States and abroad. They're available. If we are going to ask, or rather discriminate against kids who haven't gotten the vaccine and make them wear masks at school, that is isolating them from their peers. That is a violation of their privacy. That is discrimination. That is not American, ladies and gentlemen. It's not. You know, we know that if we're going to ask people to get vaccinated, why don't we ask people to live a healthier life, right? We know COVID death rates are 10 times higher in countries that more than half the population is obese. So why not implement a healthy lifestyle program in the same capacity? We know that 97% of COVID cases occur in people with low vitamin D levels. Why not issue free vitamin D at these clinics instead of COVID vaccines? We know that 78% of hospitalizations are people who are obese. Why not give people free passes to the gym or outdoor exercise? There are other measures we can do. I'm not against anyone getting this vaccine. Please understand, I am all for your right to do what you like with yourself and your family, but I beg and implore you, please, let's not go down the path of complete control. Thank you.
Thank you. Next speaker, please.
Hi. Yeah, I'd like to speak to the segregationist policy of separating us from vaccinated and unvaccinated.
Sir, I'm going to pause your time. If you could state your name for the audio record, please.
Oh yeah, Michael Stevens. And you're gonna try to require this through vaccine passports, all in the name of safety. But none of these vaccines have cleared the minimum hurdle of FDA approval. They're all considered experimental vaccines under emergency use authorization only. And you're going to try to mandate these for people to behave in society and act normally, for kids to go to school, for people to do activities that that they have rights to do. all in the name of safety, yet these vaccines have not been approved. They have not cleared the minimum hurdle. You keep changing the goalposts. Even your own gentleman here is stating we're on the track for 85% vaccination rate in the county, which is well above what Fauci's and others were saying was necessary for herd immunity. But now you want to mandate it. You keep moving the hurdles. You moved it on the lockdowns from slow the curve to stop the curve or stop the spread. You keep moving the hurdles on everything, from all the reopening for the restaurants and everything. Even your own data is showing that restaurants were never at risk. There was 2 outbreaks in restaurants in the reports, yet 109 in stores. That proves that the stores were open the whole time. There was never a risk in the restaurants. Your data all along has been completely faulty. It's been proven by all that the countries and states that have done the bare minimums have way lower numbers than the states that imposed the lockdowns, that had the strictest reopening policies. All of your policies have been an absolute failure and absolutely have not done what they said they were going to do. And how can you sit there behind your curtain and pretend that you haven't been a failure?
Thank you, sir. Next speaker, please.
Hi there. My name is Erica. I'm a mother of 2 beautiful daughters. I have a lot to go over in such a short period of time, so I'm going to have to skip a bunch and just get right into it. A mask used to prevent viral transmissions is a medical intervention that carries with it risks. A 2020 meta-analysis published on the CDC website in the USA found evidence that from randomized control trials, face masks did not support a substantial effect on transmissions of laboratory-confirmed influenza, either when worn by infected persons or by person-to-person in general community. A COVID particle is 0.1 microns in size. Surgical masks aren't designed to stop particulate matter smaller than a micron. Imagine installing a chain link fence to stop flies. Please research each mask intended use. None are for the purpose of viral defense. Mandating them is mental insanity. In fact, scientific studies prove people are more likely to catch COVID-19 if they wear a face covering. Various respiratory pathogens were found on the outer surface of medical masks, which could result in self-contamination. The risk was found to be higher with long duration of mask use. A BGM study found healthcare workers wearing cloth masks had significantly higher rates of influenza-like illnesses after 4 weeks of continued use on the job when compared to controls. The increased infection rate may be due to a weakening of immune function. Mask increased CO2, increased risk of viral, bacterial, fungal lung infections, fungal facial infections, and potential brain damage from reduced oxygen intake. A list of over 131 scientific articles and reasons to avoid face masks can be found online. Furthermore, members of the school district demanding children wear masks are practicing medicine without a license, which is a crime, illegal in all 50 states. It's a felony that carries with it a prison term from 1 to 8 years. Demanding students wear masks also fraudulently assumes they work when they don't. It's violating Americans with Disabilities Act that require reasonable accommodations be made to those with disabilities. That could include numerous medical disabilities, potentially preventing people from wearing them, such as but not limited to the following: asthma, allergies. Okay. And the experimental vaccines on children, that they have a 0% chance of dying from the virus from which they're being vaccinated from, is a type of child abuse, and I don't know why anybody would want their child to be a guinea pig.
Thank you. Next speaker, please.
Yes, my name is Joy Freeman. These mask mandates, lockdowns, and more were initiated by the number of cases as determined by the PCR test. It is fully known, and even the creator of the test states it, that these tests were not meant for significant disease diagnosis, and they are frequently wrong. I know many people who have had positives who were clearly not sick, and many people who have had all the symptoms of COVID and had negative tests. In fact, the PCR makes so many false positives that a coalition of 1,000 international lawyers and over 10,000 doctors have begun legal proceedings against the CDC, the WHO, and the Davos Group for crimes against humanity. This team presents that the faulty PCR test and the order for doctors to label any comorbidity death as COVID death is, in fact, fraud. Recognized percentages of death rates at an average of 0.5% is not a justification for classification of a pandemic. Death rates have been the same as other years, especially when you consider that now the stats held by CDC and others all state that less than 10% of the already low percentage of deaths are actually from COVID. Sweden and a number of other countries never locked down, used masks, or any enforcements. Their death numbers were no worse and most often better, and without the added deaths and psychological issues from work and financial loss, estrangement from others, suicides, and even the serious issues of the supposed vaccinations, which the deaths posted by VAERS are now over 4,000, along with thousands of cases of other serious side effects from these vaccines. All of this said is to support that it is time to admit the great feared pandemic is over, people, and never really was. Hence, it is time to completely end mask mandates, lockdowns, closures, and reductions.
All right, good afternoon. I want to welcome everyone back. We apologize for the technical issues, but we do have our systems back online, and we wanted to be able to continue our meeting in the same format and structure as what had started. Where we are is on agenda item 5. We've had the presentation. We've heard from the in-person speakers who are here in person. We're now going to go to the call-in speakers, and then after the call-in speakers, we will come to the board. So let me turn it over to the clerk to pick up our public comment on this item.
Thank you, Chair Fletcher. Any members of the public that requested to speak on this item by phone, please dial into the conference line now using the instructions that were provided to you. We will be calling speakers by the last 4 digits of their phone number. You'll hear a notification that your call has been unmuted. You will then need to press *6 to unmute your phone and ask that you please state your name for the audio record. You'll have 2 minutes to address the board. I'll remind the public speakers that they should mute their TV or live video stream before they begin speaking. And if you could please identify the first caller.
Our first caller is 9665. 9665. Please press *6 to unmute.
Good afternoon. My name is Maria Cano. I have worked for the county for 6 years as a nursing assistant at Edgemore Hospital. I am also a proud SEIU Local 221 union member. I keep patients and the public safe by wearing the PPE, personal protective equipment, or I get relocated if needed. Constant hand washing and even reminding patients to use hand sanitizers in hallways. Wearing the PPE and N95 on a daily has been disrupting to the normal daily routine. It consumes a lot of time, very uncomfortable to use, and as for the patient, it makes them feel like they are contagious. And the N95 causes shortness of breath, anxiety, cuts, and even bruises on our faces. N95 can't be worn by everyone. People with medical history like asthma, our levels of anxiety have risen. All of these become problems here at Edgemore because our staffing census changed. We already had that prior to this pandemic, and it's getting worse and affecting patients' care crisis. Even though we are afraid to come to work and pass COVID to our family, we come every day. We have a total up to date of 70 employees and 35 contractors that have positive to COVID. We need solutions now to support our workforce in providing care for our patients, starting with hiring more staff. Additionally, throughout the county, we have been advocating for hazardous pay for county employees.
Thank you, ma'am.
Our next caller is 1113. 1113. Please press *6 to unmute.
Hello, Chairperson Fletcher and Supervisors. My name is Jacqueline Westby, and I am a member of SEIU Local 221. I'm an occupational therapist at California Children's Services within the Health and Human Services Department at the County of San Diego. CCS operates within public schools in the county and provides medically necessary services to children with a variety of physical limitations and chronic health conditions or diseases. While the program is currently operating as a hybrid model whereby some staff remain working from home and many staff are working in person directly with the public, I am asking for hazard pay for frontline workers. What has initially been offered at the table is not enough. We demand more. Hazard pay recognizes our hard work and sacrifice, as well as covers the additional costs for working from home and or being able to access childcare to work in person. For me, a drastic shift in costs associated with the need for increased mental health services has taken a hard hit to my bank account, leaving me to choose between my overall well-being and health and paying necessary bills to survive within this county. And I make an above average salary. Fellow colleagues are seen day in and day out having to make exceedingly difficult life decisions that will eventually impact us all in the long run. It is essential to provide not only equity increases, but also hazard pay to support the goal of racial and economic justice in the region during these unprecedented times. The county must invest in the dedicated employees that are working hard for and sacrificing our own health and safety, as well as our families' health and safety, to serve the children, families, and community members of San Diego County during this crisis. We ask that you allot increased hazard pay for those of us who serve on the front line. As David Garcia well said, it is time to respect us, protect us, and pay us. Thank you.
Thank you. Our next caller is 7448. 7448, please press *6 to unmute. 7448. Please press *6 to unmute.
Hi, can you hear me?
Yes.
Okay. Good morning. Afternoon. My name is Rachel Randolph, and I have worked for the county for approximately 9 years. As a proud union member, we have been advocating tirelessly about the workplace at these meetings and at the bargaining table. My coworkers and I have sacrificed during the pandemic by going to work every day relentlessly at Polinsky, regardless if the kids are COVID positive or not, doing our job. Sometimes that involves holding a child who is COVID positive, who doesn't understand that we need the 6 feet space. Also, we've had coworkers who've contracted COVID from work who were running and jumping and able to live their life as 50-year-olds should be, and after having COVID, had to retire because they're no longer able to walk without being dependent upon a cane, which they aren't able to work at Polinsky with the cane. Extremists are seeking to divide us as frontline workers and a community, but we thank you for seeing through all of that. We know that you understand that we should receive hazardous pay. We ask you to tell the county staff to finish the job and offer a fair agreement on hazardous pay. Please vote yes on the item. Vote yes for county employees. Respect us, protect us, and pay us. Thank you.
Thank you. Our next caller is 9358. 9358, please press *6 to unmute.
Hi, my name is Amina Corsani from the Center on Policy Initiatives and the Invest in San Diego Families Coalition. I'm calling in today to express our concerns about the county's process to develop a spending plan for the COVID-19 American Rescue Plan Act, or ARPA, and stimulus funding, which will be brought forward for deliberations and approval to the board on Tuesday, June 8th. On April 6, 2021, this board approved a conceptual framework outlining a general spending plan, and on May 4th, the board directed the CAO to work with supervisorial offices after ARPA funds and guidelines are received to ensure their input is reflected in the CAO presentation on June 8th. However, this process to develop the more detailed spending plan is largely taking place behind closed doors, and there is no opportunity for public input into how $996.1 million of public funds will be allocated. In the absence of meaningful opportunities for public input, we urge the supervisors and CAO to prioritize the ISDF recommendations for ARPA funding, which include $40 million for hazard pay for county employees on the front lines of COVID response, $15 million over 3 years for the provision of free tenant counseling and legal services, and $10 million for direct stimulus payments in the form of cash aid to low-income immigrants excluded from federal and state benefits. We also ask that in the interest of introducing some level of transparency into this process, that the board direct the CAO to publicly post all of the supervisors' ARPA priority letters as part of the online documentation provided for the relevant item once the Board of Supervisors meeting agenda for June 8th, 2021 is made publicly available. Please consider these recommendations, and thank you for your time.
Thank you. Our next caller is 2813. 2813, please press *6 to unmute.
Hello?
We can hear you.
Hi, this is Sandra Martinez. And I wanted to just say, you know, San Diegans really need meaningful information about the local COVID data. For example, what is a COVID death? Is it someone who died of COVID? Is it someone who died with COVID, had presumed COVID, or had COVID as a primary cause of death? Have you analyzed the data identifying COVID cases or deaths of those who were vaccinated versus those who were unvaccinated? When someone dies post-vaccine, do you test for COVID? And if so, what PCR cycle threshold do you use? We know that PCR testing can often be incorrectly calibrated, creating a case-demic. Through manipulation of the chosen cycle threshold, data is misrepresented and statistics are manipulated to create the illusion of a health emergency. That is political science, not medical science. So what was the threshold used by the majority of last year, since we know the high cycle threshold creates phony results? What is the cycle threshold currently being used? And if it has changed, on what date did it change? Is the cycle threshold different for the vaccinated versus the unvaccinated? At any point, have you modified your criteria for coronavirus case diagnosis, or is it still simply a positive PCR test, which cannot diagnose COVID? All San Diegans need answers to have any modicum of confidence in you. I have emailed the Public Department of Health and received no response. So I would like to know, how do we get answers and how do we get results?
Thank you. Our next speaker is 7872. 7872, please press *6 to unmute.
Good afternoon. My name is Allison Hartman. I am a co-founder of a group called Reopen San Diego, former middle school science teacher with San Diego Unified School District. And I have grave concerns over how the COVID response has been handled by the Board of Supervisors. Specifically, when you talk about evidence-based policy and how you want to do that, and then you do not follow guidance from the CDC, instead following arbitrary guidelines set down by the state. There's no evidence for anything that the state is doing. So why is the board following what the state is doing? Well, people, kids, business owners, citizens are suffering. Our ICUs are packed with kids not dying of COVID, but literally trying to kill themselves because they don't have anything to look forward to. They don't have school 5 days a week still. And when they are in school, they are required to cover their face with a filthy piece of cloth that has no scientific basis. This is a travesty. And anybody leading this city right now needs to answer to this. And the next thing is there's no state of emergency as defined by the California Constitution. Maybe you should look at the California Constitution and see what a state of emergency is, because we haven't been in one for probably about 14 months now. So why are we under any restrictions whatsoever? This is unlawful, this is illegal, and this is fraudulent. And if it is done to receive any federal or state money, CARES money or other monies, then that is, another level of fraud. And anybody complicit in that will have to answer for that. We, the citizens, demand an end to this state of emergency now. Thank you for your time.
And that concludes public comment on this item, Chair Fletcher.
All right, thank you to everyone who called in on this item. I'm going to go to my colleagues now. I see Supervisor Desmond with his virtual hand raised. Supervisor Desmond, we'll start with you.
Well, thank you, Mr. Chair. I appreciate the time, and I appreciate how quickly the county got back online here with the technical difficulties. So kudos to everyone there. I would like to say, though, I do, sympathize with the people with the frustration over the masks. When the CDC came out with their findings, and then the president repeated it, and now the state of California has decided the take and wait and see type of, keeping it until June 15th. I share in their frustrations, and it's a lot of confusing messages out there, but the governor has spoken, and so here we are. I did have a question, though, for Nick Mascione, and then I have other comments after that. But For Mr. Mascione, for the percentage of the vaccinations, I don't know if you have this off the top of your head or not, and if not, that's okay. But I'm just wondering what the percentage of those 65 and older have been vaccinated in the county, because that was our target most vulnerable population. And I'm just curious if you have that number or not. I can get it later from you, but do you know that number off the top of your head?
Supervisor, I do not. We'll get that for you. I can tell you, though, it was very high in South Bay in terms of our population, nearly almost 99%. But I think to get it for all the regions, I'll get that to you back.
Okay, well, thank you. It's because our initial fight was, I guess, or focus, not fight, but focus was on the most vulnerable and those 65 and older. And I was just curious what the how many of those have gotten vaccinated. So since I'm in that group now, but anyway, I want to say thank you to Dr. Wooten and to our CEO Helen Robbins-Meyer from the entire team and healthcare partners and everybody that's rolled up their sleeves in this effort. And we're seeing a good outcome from all of those efforts. And I'm really glad to see that we got plenty of vaccine now, and the numbers are coming down and going in the right direction. But as we continue to open the economy, some sectors still have capacity restrictions. Restaurants still have capacity. I think some retail still has capacity restrictions. And I think, we need to do everything to keep them in business. They're still struggling. And we need to get as many people back to work as possible. We hear about rental assistance and all these other type of assistance programs. If we can get people back to work, we wouldn't need as many assistance programs. But along those lines, jurisdictions across San Diego County, including in the county, began allowing restaurants in the unincorporated areas and the cities to be open outdoors, some on sidewalks, some on the streets, some in parking lots. And many restaurants invested significant dollars into the infrastructure, the tents and platforms and the propane heaters and all those other things to expand their outdoor dining and when outdoor dining was allowed to happen. And so they could survive and continue to operate. But many customers, still may be squeamish about not comfortable about dining indoors. So I have a question for staff. I guess this is for the Department of Environmental Health. As we begin to open things up, is there any action that the county needs to take that would allow cities in the region and in the unincorporated areas to allow continued use of the expanded use of outdoor dining through the end of the calendar year or through the end of the declared emergency? Is there any sort of a blessing that the Environmental Health Department needs to give, or can that be allowed while the emergency is still in place?
Let's go to staff and get a response to your question, Supervisor.
Thank you.
Hi, Supervisor Desmond. Amy Harbert, Director of the Department of Environmental Health and Quality. There is nothing more that restaurants need from the Department of Environmental Health and Quality to continue their outdoor operations. As long as they have their annual health permit from us, they can decide to make their business decisions to do indoor, outdoor, takeout, whatever they may choose.
Okay, well, thank you. That's good. And then I guess another question to staff is specifically to the unincorporated area, because that's all we really control as far as restaurants. Will land use departments allow restaurants and businesses to continue operating in an expanded outdoor capacity on the public sidewalks and or streets and parking lots? Would they be allowed to continue that in the unincorporated area again until the end of the emergency? This would be for, I don't know, for our, let's see, this would be for our code enforcement and staff. Would that be allowed?
Yes, through the chair, Supervisor Vince Nicoletti, Acting Assistant Director with Planning and Development Services. Yes, we plan to continue allowing the zoning flexibility to facilitate outdoor dining until the end of the health emergency or until social distancing is no longer needed, and there is no additional action needed for that to continue.
That's great. Glad to hear. So to be clear, nothing additional is needed from the county to do this countywide. And I know it's up to the individual cities, for their sidewalks and their parking lots and their public right-of-way. So I do think, allowing extending the time and allowing the businesses and the restaurants to operate is good for the restaurants. Hopefully they can catch up on some of their, some of the business that they lost. And I know in Fallbrook, they actually opened up downtown Fallbrook a couple of blocks at least, where they blocked off the roadways with the help of the county. Thank you very much for that. So hopefully our cities, I'd love to see we continue that effort in the unincorporated areas in the county. And then also if the cities, have them be aware and know that the county, as far as the health inspections and things like that, they're still going to be allowed to stay open. So that is great news. Thank you very much.
Supervisor Desmond, on that point, though, there may be something we need to do to think about post-state of emergency in terms of outdoor spaces. It may not look exactly like what it is now, but I think a lot of businesses have seen the value, and I think a lot of consumers really enjoy the opportunity and option to go outdoors. And so we've got some time, but I think we ought to think about what outdoor type efforts ought to be ongoing and structural instead of those just tied specifically to the state of emergency. So I think we've got good news where we are and for the foreseeable future, but it might be an issue worth thinking about a little bit more long term. The second thing, Supervisor, we got the answer to your question, at least for first doses. 86% of San Diego County residents 65 years and older have received their first dose. We're working to get the fully vaccinated number, but again, it's 86% of San Diego County residents 65 and older have received at least their first dose.
Okay, yeah, I'd be interested to know how many got the second dose in that age group. Thank you.
Should know that very soon. Okay, I'll make a motion to adopt the 3 recommendations presented for us in the COVID-19 update. And just very briefly state, we're heading in the right direction. Our case numbers are doing good. Our vaccinations are doing good. People are opening up. We have a few more weeks to go. We are looking eagerly ahead towards June 15th as a date in which everyone should have had access not only to their first dose, but their second dose. And with appointments just recently becoming readily available, folks are accessing them more and accessing them in different ways. The absence of a vaccine passport program, because there's been such widespread opposition to that, makes it difficult to put in place unique circumstances at this time simply for those who have been vaccinated. Things like saying no mask if you've been vaccinated when you have no system for businesses to actually tell who's been vaccinated and who has not complicates our efforts to move more rapidly. But I think we're eager for June 15th, the lifting of the tiers and alignment with CDC guidance, and it's just a few weeks away, and we should all be proud and pleased with where we are and where we're moving. So we have a motion to approve. Is there a second?
I'll second.
All right, we have a motion by myself, a second by Vice Chair Vargas. Any other board member comments or questions?
I just wanted to.
Please, Vice Chair Vargas.
I just wanted to quickly say thank you to the staff of the county staff for doing such an amazing job, specifically pivoting really quickly with the youth. I know my niece got her vaccination, so I'm really grateful for that and the fact that she was very smooth and the way things are working, especially the partnerships with the school district. So I wanted to say thank you for that. And then for the continued work with our community healthcare workers and promotoras, the interventions are really working, and we saw that in South County, and I know that we're moving them now to North County and Central. So, I just wanted to say thank you because all of you have been doing an exceptional job. Thank you.
Thank you for that. All right, seeing no other comments or questions, I'll ask the clerk to please call the roll.
Thank you. Supervisor Anderson.
Aye.
Supervisor Lawson-Remer.
Aye.
Supervisor Desmond.
Aye.
Vice Chair Vargas.
Vargas, aye.
Chair Fletcher.
Fletcher, aye.
That motion passes unanimously with all supervisors being present and voting aye.
We're now going to move to agenda item 15, our third quarter budget update. I am going to turn it over to staff once they have an opportunity to get reset for their presentation, and then we will hear from any speakers on this item and return to the board.
Chair Fletcher, members of the board, today I'll report on our economic environment, review projections of the budget performance as of the third quarter, and discuss our path ahead. Starting with the economic outlook, the dashboard that we'll have here up in front of us here from SANDAG provides a snapshot of several key metrics that we've talked about here in the past, and I'm on slide 3 here for you all. The hardest hit sectors continue to be tourism, retail, and education, representing 80% of the region's job losses, down from 89%, although consumer spending has continued to improve since the start of the year. Let's review the status of our region's labor market more closely. Yeah. We'll give the team a second to bring up the presentation. And we can advance to slide 4, please. Thank you. Okay, so we'll take a look starting here with the local unemployment rate, which diagnoses the health of our economy and can indicate demands on our safety net programs. Fortunately for San Diego, the unemployment rate in March dropped to 6.9% from 7.2% in February, but we still have roughly 106,000 San Diegans out of work. At the national level, the most recent data released for April reported gains in the tourism sector, and we'll be watching very closely when April figures are released this Friday for San Diego and California, and are hopeful to see similar trends for our region. With these rates of unemployment, what's happening with income levels in America's finest city? This slide shows average wages for high, middle, and low income earners from 2009 to 2020. The data comes from the California Employment Development Department, and I'll focus on high and low income earners. Prior to 2014, high income earners experienced faster growth in wages than low income earners, but since that time, that trend has shifted, with low income earners experiencing faster growth, which is great news. But there's still a gap between our high and low income earners, and that serves as a reminder to us of the challenges that those who are still unemployed face in this recovering economy. Taking a look now at those hardest hit sectors, the job losses due to COVID, you can see that a little over 98,000 jobs lost were generated in just 3 sectors. And being widely reported across the nation, the tourism and hospitality sector is having a difficult time finding employees as we look to reopen our economy. So here in the summer months, the tourism activity here in San Diego will be a really important indicator on the trajectory of how we're going to recover over the next several months. And as you all know, foot traffic is different than spending and unemployment, but it's another metric that we use to gauge how our recovery is going. It tracks the change in the movement of people from different places. And to sum this all up, all foot traffic took a dip after the holidays and the regional stay-at-home orders, but now traffic is picking back up again, which is good news. And we expect this trend to continue. But there are some industries like grocery stores that we see with the dark purple line, which is a part of the retail sector, which just might look different permanently as we go forward. At the start of the pandemic, we all rushed out, traffic spiked, and we went to go stock up on essential items. And since that time, we've seen grocery stores readily adopt delivery and pickup services. So we see that number has steadily declined to its current level now. Foot traffic of restaurants, the bold yellow line, which is a part of the tourism sector, is on an upward trajectory, and that's fantastic news. Moving to the real estate market, historical and projected assessed value, or AV, and its growth rate in total assessed property values directly influences your board's discretionary revenue source, general purpose revenue, which is derived primarily of property taxes. The black line on this slide depicts the annual growth rate as a percent, with the blue bars representing the total value of the assessment roll. Since we last spoke on this topic, the assessor has modified his growth projections to a range of 2 to 3%, and we're using the top of that range for planning purposes as we move into budget. And I believe that recommendation is more likely considering the growth in residential housing that we see happening now. And it takes into account the uncertainty that we are still experiencing with the potential value reductions on commercial properties due to Proposition 8. Finally, as the economy has recovered over the last several months, we've seen strong performance in the SD Sarah Fund. As of March, the fund earned a promising 19.2%, and assuming this trend holds through to June 30th, this will help to partially mitigate the fund's failure to meet its earnings target over the last several years. During the second quarter economic update to your board, there was a question outstanding about whether or not SD Sarah's board would take action to consider conducting an early triennial review out of cycle, and the board did not take action to do that. That action is scheduled to occur in 2022. And so as a part of preparation for that scheduled review next year, we will need to rebaseline our projections not only to take into account the volatility that we see here in in earnings rather, but also to prepare for any changes that the county's actuary may make to its actuarial assumptions, including a downward trend in inflationary assumptions, as well as potential changes to the market earnings assumption. And I'll update your board with a more comprehensive retirement update reflecting these assumptions after we get through the fund's final June 30 earnings report. With all of this as background, now I'd like to turn our attention to actually focusing on how the local economy is impacting the current year budget performance with our third quarter projections. Before I start, I think it's important to keep in mind that these projections and the resultant impact to our balance sheet, which I'll be going over with you all here in the next few slides, are all heavily influenced by the solutions that we brought to the table to close this budget, including the use of one-time resources that we use to close budget gaps to mitigate expected revenue shortfalls that have not been as impactful as we anticipated, as well as now we have the infusion of unanticipated federal revenues to help support our emergency response efforts. Overall, the county is projecting positive results from budget for all funds of $413 million. This includes $140 million outside of the general fund, which I'll discuss in more detail for you here on the upcoming slide. But now let's focus on this slide, which is the projected expenditure and revenue variances for the general fund only. Expenditures and revenues combined for the general fund reflect a overall positive $272.6 million variance, which is the equivalent of 4.5% of the total general fund budget. However, as noted in the blue boxes underneath the $272.6 million, this assumes that spending will exceed budget by $273.7 million, offset by $546.3 million in unanticipated revenue. These spending and revenue variances are concentrated primarily in the Health and Human Services Agency and the assumed recognition of the American Rescue Plan Fund Acts to cover cost of our T3 strategy, as well as to replace previously allocated unassigned general fund balance to support our COVID-19 response. These assumptions are being reviewed in the context of the recently received interim guidelines for the American Rescue Plan Act, and staff plan to return to your board, as you heard this morning, with action to take appropriation action to mitigate the projected overspending when we return to you next month. The projections for the general fund also continue to reflect the better than anticipated general purpose revenue due to lower than expected property tax delinquencies and unanticipated increases in redevelopment pass-through distributions driven by favorable litigation, and better than expected assessed value growth, all of which has been incorporated into next year's budget. Next, we'll focus on variances from budget outside of the general fund, which represents $140.6 million of the third quarter overall projected operating results. The majority of this variance is concentrated in our special revenue funds and reflects better than anticipated sales tax receipts in the Proposition 172 Special Revenue Fund, unanticipated gas tax funding in the road fund, and property tax related revenues in the library fund. The action before the board today includes recommendations to increase the total budget by $9.6 million, which includes an increase of $1.2 million in the general fund, and will provide authority to make other adjustments that do not increase the overall budget. Now I'd like to briefly transition to how these budget results could potentially influence our financial statements, specifically our balance sheet and our unassigned balances. This slide is an updated snapshot of what the general fund unassigned balance could look like at the end of the fiscal year, given everything that we've discussed, and of course knowing that things can change, and they will change. But to understand where we may end the year, we have to start by tallying up all the activities that might occur between now and then. We start with last year's unassigned balance, which is roughly $708 million at the top of this chart. And then we add in the $272.6 million of general fund operating results and the reclassification of amounts that were previously set aside for redevelopment litigation. Next, we subtract amounts that were approved by the board to be used throughout the year, which is roughly $49 million, And then we subtract the amounts that are recommended to be budgeted in next year's op plan, and this amount is currently $145.5 million. And finally, we take into account the estimated amount of actions that have been or will be referred to the budget, including actions planned in the CAO's change letter. At this point, all said, those items total to just under $55 million. Assuming that all of these actions occur exactly as estimated, this would result in an ending balance of approximately $775 million, compared to an estimated minimum of $829 million, or a draw of roughly $54 million below the minimum. And just as a reminder, certain provisions of the fund balance and reserve policy have been suspended in recognition of the local emergency, including the prohibition against drawing below the minimum reserve target. In addition, the board's finance subcommittee is actively engaged in discussions regarding the fund balance and reserve policy. As we look ahead, there will continue to be impacts from the pandemic now and as we move forward, but we're seeing some positive signs from the recovery. Our team is really excited to implement the board's new priorities within the framework that is laid out for the county, to not only have a successful recovery, but really for a prosperous future long term. With that said, and as you know, we won't be able to address everything in one budget, but we're doing a lot for sure. We're seeing positive performance in the retirement fund, but we can't celebrate yet until the markets close on June 30th. And even then, we have to continue to prepare and plan for future changes to the actuarial assumptions to ensure that we maintain the benefits that we've promised to our employees. There's a lot of excitement about the investments that are going to be made for our region through the American Rescue Plan. And on June 8th, we'll present recommendations to your board on how to allocate these funds, including recommendations incorporating feedback from your offices. And finally, the governor's May revised budget proposal came out on Friday. A complete analysis will come to your offices next week. However, there's certainly good news, including the state's unprecedented $100 billion comeback plan. And the actions that are being taken to prioritize investments such as assistance for low-income families, small businesses, behavioral health, broadband, the list goes on. All of these actions nicely align with your board's framework and are certainly going to create a synergy for our region as we move through the next phase of this recovery. Subject to your questions, this concludes my presentation.
Thank you, Ebony. We do not have any public speakers on this item. I do see Supervisor Desmond will go to you first.
Thank you, Mr. Chair. Ebony Shelton, I just want to say thank you so very much for these updates. I really appreciate the trend charts that you put in here and the updates that we've been getting, particularly throughout the COVID here. So we see both sides of the equation, and you know, really good news on the retirement investment returns. Is hopefully that'll help us in the long term. But thanks for the update.
Thank you.
We did just get one request for public comment right after we said there were none. So let's go hear from our public speaker, and then we'll return to the board.
We're just waiting for that individual to dial into the conference line. If the individual that requested to speak in item 15 could please dial in using the instructions that were provided to you.
While we wait for that commenter, I'll go ahead and put a motion on the table to approve the recommendations in agenda item 15. Is there a second?
I'll second the motion. I just have a question.
Second by Vice Chair Vargas. Vice Chair, let's go to your question, and then we'll come back and see if our public speaker is with us.
Thank you, and thank you, Ebony, for such a thorough presentation. I have one quick clarification that I need and that's that one of the projects from the San Isidro Modular for the building project is listed as canceled as a result of the APCD transition. And so I'm just trying to figure out if that project is going to be continued through the purview of the APCD.
I believe we have the Land Use and Environment Group Finance Director or General Manager here. I'll have to defer to them.
If you don't have the answer today, you want to just send it
you.
to me. I just realized that I probably, that would be fine too.
Thank you.
Vice Chair Vargas, yes, that will continue through the Air Pollution Control District. This is just simply transferring it to the district now that it's independent of the county.
Fantastic. Thank you.
Sure.
All right. Is our speaker on the line?
The speaker has not joined, but I will note that the speaker was in favor of the recommendations.
All right, then they should be happy. We have a motion by myself, a second by Vice Chair Vargas. Let's call the roll.
Thank you. With that, Supervisor Anderson.
Aye.
Supervisor Lawson-Remer.
Aye.
Supervisor Desmond.
Aye.
Vice Chair Vargas.
Aye.
Chair Fletcher.
Fletcher, aye.
That motion passes unanimously with all supervisors being present and voting aye.
We're going to move to agenda item 16, Office Evaluation, Performance, and Analytics, a board letter brought forward by Supervisor Lawson-Remer and myself. If you wish to speak on this item, please call into the conference line at this time with the directions provided to you. We will begin with introductory comments from Supervisor Lawson-Remer and then go to our public speakers.
Great, thank you so much. I have a lot to say about this item because I think it's extremely important today. So often we see public agencies making decisions based on ideology or conventional wisdom or ideas or stereotypes that conform to pre-existing assumptions. But this is a bad way to make sure we are getting the outcomes we want. It's a bad way to make policy, and this action seeks to change that. We need policy based on evidence and facts and data, not on gut guesses or political theater. We face incredibly deep challenges right now in our community and our society, to public health, to racial justice, on economic inequality. And in times like these, every action we take needs to do more than sound good. It needs to do good. Our tax dollars need to make the biggest impact possible and be used as effectively as possible. In my former work as an academic and an advisor with the World Bank and the United Nations, I spent many years conducting research, evaluating programs and policies, and crafting evidence-based solutions to our most pressing global challenges. Research from the Pew Charitable Trust and the Urban Institute have linked evidence-based policymaking with better outcomes for residents, with strengthening accountability and transparency, with sounder stewardship of public resources, and with cultures of learning and innovation that can adapt to new situations. By highlighting what is working and what is not, evidence guides and informs our actions as a county, resulting in outcomes and programs that are more effective, more equitable, and more sustainable. That's why I am honored to partner with Chair Fletcher to introduce a bold new approach to evidence-based policymaking that will be a critical part of the framework for the future for our county. This action will do many things to drive this initiative forward. It will establish an evaluation office, an office of evaluation, performance, and analytics to oversee the county's efforts around evidence-based policymaking and related initiatives. It will provide support to the entire county organization and report directly to the Chief Administrative Officer. This action will also direct the CAO to conduct a national search for a Chief Evaluation Officer to lead and staff up this office. And this action will establish an evaluation advisory committee that can review, analyze, and make recommendations on this office's plans and provide ongoing strategic advice on data collection methodologies and more. We envision this group to be comprised of highly experienced experts drawing from academic institutions, think tanks, and independent researchers and policymakers with deep subject matter expertise. The CAO will provide regular updates to the board on these directives and report back with a detailed implementation plan. Rather than trying to evaluate everything the county does, we anticipate that this office will strategically focus on programs that align with county priorities and the programs that have the greatest potential to influence major policy decisions and budget allocations. To do this, the office will develop an annual strategic research plan. This work goes far beyond mere data collection. This initiative will allow us, as a county, to learn from setbacks and scale up successes, to embrace a culture of learning, adapting, and improving. This initiative is consistent with actions now happening at the federal level, where agencies have been directed to put scientific integrity and evidence at the center of federal policymaking. This initiative will also put us in good company with proven practices developed by national and global experts. So thank you, and I join Chair Fletcher in requesting your support for this new approach to county operations. And with that, I would like to make a motion to approve this item. Thank you.
Thank you. Thank you, Supervisor Lawson-Remer. I'm happy to second that motion. It's my pleasure to partner with you on this. I want to highlight the interest in building the capacity of our county to provide innovative data analytics and collection is in part driven by the desire and the need we have to analyze the impacts of what we're doing at times at a more granular level. Through the work with our behavioral health forums, I've heard tremendous input about the importance of data sharing, creating technology solutions to help us identify the needs of clients in our system. Many of our systems cross multiple platforms with multiple different inputs, and the ability to coalesce that data together, not only to look at the totality of what we're doing or what we ought to be doing, but in instances like when it comes to behavioral health, to be able to better track the individual outcomes and their access to programs, seeing if those individuals experience a service or program, is it successful or not, and how can we have that drive better results. And so I think that there are a lot of opportunities here as we look structurally across our county, as we look at all of the different things that we can do, not only looking holistically from a broad level about the overall direction, but getting in and tackling some of these siloed fields of data and having some expertise and some capacity to help design things that are more interactive and more engaging. And I'm really pleased, hopefully we can move forward on this today. Very pleased to see in the proposed 21-22 budget several new positions in behavioral health focused on data science and analytics that can work collaboratively with this effort to help ensure that we are moving forward, along with the things we've done around racial justice in our Office of Race and Equity and the data requirements of reporting back around that. And so excited to hopefully have enough support today to get this up and moving, get the experts at the table helping us design programs, steer resources, and better ensure outcomes for those things that are already there. And so happy to second this motion. Let me at this time see if we call for our public speakers on this item.
Thank you, Chair Fletcher. We had 2 requests to speak by phone on this item. Also note for the record that we received 31 e-comments. We will be calling speakers by the last 4 digits of their phone number. You'll hear a notification that your call has been unmuted. You'll then need to press *6 to unmute your phone. And we'll ask you to please state your name for the audio record. You will have 2 minutes to address the board. And if you could please identify the first caller.
Our first caller is 3640. 3640, please press *6 to unmute.
Hi, hello, my name is David Garcia. I'm president of SEIU Local 221, representing more than 12,000 public employees in San Diego and Imperial County. I urge you to vote yes to create the Office of Evaluation, Support, and Analytics. The first 5 months of the new board has shown that there is a shift in values that is happening in this county. The current leadership actually cares about working families, vulnerable populations, equity, and racial justice. As we begin a transition to a so-called post-pandemic world, it isn't going to be enough to talk about these values. Our county faces challenging problems around homelessness, mental health, and working families struggling to make ends meet. This is why the timing is critical to establish this office now. The best approach to these problems is to look at the data, to better understand them, and not just be based on receiving some type of award. This sets up a data-based approach to devise solutions that are guided by ongoing evolution. We support this office so that our county can be a leader in providing opportunities for all San Diegans, and we leave no one behind. Please vote yes on this item. Thank you for your time.
And Chair Fletcher, I'm not seeing the second caller in the conference line at this time, so that appears to conclude public comment on this item.
Okay, we have a motion and a second. I see Supervisor Desmond's request to speak, and then we'll go to Supervisor Anderson.
Thank you, Mr. Chair. I just want to say thank you to Supervisor Lawson-Remer and yourself for bringing this item forward. I always think there's many different ways to look at things, and as we bring programs and projects forward, having a data-based assessment of those projects and see if they're doing, if we're getting the bang for the buck that we thought we might. Maybe we do better, maybe do worse, but it's good to have another set of eyes and another set of analytics to take a look and make sure what we're doing is right. So I applaud you for bringing it forward, and I'll be voting in favor. Thanks.
Thank you, Supervisor Desmond. Supervisor Anderson.
I just have a quick question. This approach is taking on the whole county. Did you consider taking on a department, developing a proof of concept to make sure we're on the right path, and then expand it out in? I'm just asking for the rationale. I'm sure you considered it, but what was the consideration?
Supervisor Lawson-Remer.
Sure, I'm happy to answer that. There's no question that there will be particular programs chosen as proof of concept, but it's not really, I think it's not on us as a board to figure out what those are, right? That's why we want to get the Chief Evaluation Officer in there, and they can think strategically about which programs are the right ones to focus on as proof of concept, because certainly, we're not going to do everything, not even nearly everything at once. So, we don't even know which the right programs are to focus on as proof of concept, but there certainly absolutely will be a couple that are piloted, and I will very much be looking forward to guidance and feedback from staff and our new new data leadership to determine which programs make sense to pilot.
I have a follow-up question.
Please.
When this initial phase, that is just telling us how we need to pursue further investment of I'm trying to put my arms around it. I'm sorry, I'm not describing well. So this is just giving us an idea of how we need to approach the subject, and then it's followed up with actual using the data. Is that exactly how it will work?
Should I go ahead?
Please.
I think we've outlined a pretty long board letter of how I think we envision this working, right? But we're going to be hiring a whole data team, led by a Chief Evaluation Officer, to start supporting all of our departments. Many of our departments are already doing great work on data and analytics, and they need support. They haven't had the staff capacity, and they'd like to be doing more of that, and they haven't had the support at the board level to be doing that work. So a lot of what we're doing here is building on the existing initiatives from staff, but making sure that there's proper and appropriate staffing and support to scale up the things that are already working. In addition to that, we're putting in a strategic framework so that it's not piecemeal efforts. One department is doing one study and not doing another study, and they don't have any support across the team, and they don't have any data officers, and they don't even have any strategic guidance on what we're choosing to study and what we're not choosing to study. So we are simultaneously making sure that we're appropriately going to be staffed in every department to be doing the data and analysis, as well as having some strategic thinking at the CIO level regarding what programs should be being analyzed, where we need to be having better data collection. I think a very specific example that Chair Fletcher alluded to, but I think it should be on top of all our minds, is our commitment to equity. So it's extremely difficult to advance a commitment to equity when we don't have disaggregated data regarding which populations are benefiting, what are the disparate impacts across different population subgroups, and we don't have consistency on sort of the vision and the strategy around that kind of data collection and disaggregation for program impacts across all of our program areas. And so when we look at some of these strategic commitments we're making at the board, I think the commitment to equity is such an important one. we can't really advance them in a coherent way if we're not collecting this data across programs and looking consistently and coherently across programs on these kinds of equity impacts. So that is just a very narrow example that has very, very broad implications around why I think this is such a vital initiative to help guide all of our work. And it isn't about one program or another program. It's about an approach to how we think about the work that we do, that we're guided by evidence, we're guided by ensuring that we're making the biggest impact possible on the communities that we seek to serve. We're making sure that the programs are actually having the effects that we intend, that we're ensuring that these frameworks and objectives that we put out here as a board are actually being met. We can track them over time, and we can actually see whether what we're proposing to do is working and not working and pivot appropriately. I'm obviously quite passionate about this because it's something I've spent much of my life working on. And I can tell you, having spent many years looking at data and spent a lot of time fighting to ensure that we have disaggregated data and that we're collecting data coded appropriately, it makes a massively big impact on program design from the outset if you know that you're going to be tracking disparate impact and you're going to be able to disaggregate data and be able to highlight the equity impacts of your work. So happy to talk about this forever, but I will continue to not do that at this meeting. Thank you.
Thank you.
I just have a follow-up question. So we're going to look at effectiveness. Will we also be looking at efficiency? And will that include possibly streamlining or downsizing so that we lower our costs to provide better products?
I'm going to go ahead and answer that question again. I mean, there's no question that that's a piece of this work, right? That's why we have to look at effectiveness, is so that we can make sure that our resources are being spent as efficiently as possible to achieve the results that we need in our community. And I don't think this is an initiative that's going to bear fruit next year, right? This is a long-term pivot towards a county that's really focused on achieving the maximum results possible for our communities. And I don't think it's going to be next year or the year after. It's going to be 4 years, 8 years from now that we're able to really say, look, we've slowly, piece by piece, seen which programs are working better than others, and we scale those up, and which programs are working less well, and we scale those back. And I am very much looking forward to this new Chief Evaluation Officer working closely with Ebony and the Chief Financial Officer to think about how we align our budget resources to be as effective as possible in serving our community.
Vice Chair Vargas.
All right. I want to thank my colleagues, Chair Fletcher and Supervisor Lawson-Remer, for bringing this item today. It is critical, obviously, that policy be based on data and disaggregate data for that and high-quality research. I will say, after managing programs for Planned Parenthood for over 20 years, I do want to make sure that we consider ensuring that sometimes the evidence-based programs, we did a lot of evidence-based programming and had to report back to federal government and state, et cetera. And so I just want to make sure that we consider that one of the biggest challenges with evidence-based programming is that at times culturally relevant ways of how local programs adopt non-traditional approaches to serve communities of color and connecting and capturing community engagement is not part of it. So I would hope that that would be considered in this process, because it's super important that we look at non-traditional ways of capturing data and doing this evidence-based work. And so that would be one. And then the other thing was that as we are looking at this Evaluation Advisory Committee, one of the biggest challenges that we have in academia is that we don't have a lot of representation from communities of color. And we do have the power here because we do have, UC San Diego State, our community colleges have a lot of researchers and folks that are from our communities that understand our communities. And so considering that these evaluation advisory committees have folks also from the community who are doing the practicum work on the ground beyond just the research, in academia, which is exceptional and important, but I think there has to be a combination. So I fully support it. I just would hope that you consider those items as well as you're thinking about, as the CIO is working together with all of you to develop what this program looks like. Thank you.
Thank you, Vice Chair Vargas. All right, seeing no other questions, we have a motion by Supervisor Lawson-Remer, seconded by myself, to approve the recommendations in Agenda Item 16. I'll ask the clerk to please call the roll.
Thank you. Supervisor Anderson.
Aye.
Supervisor Lawson-Remer.
Aye.
Supervisor Desmond.
Aye.
Vice Chair Vargas.
Aye.
Chair Fletcher.
Fletcher, aye.
The motion passes unanimously with all supervisors being present and voting aye.
We're now going to move to agenda item 19, capital projects, a board letter brought forward by Supervisor Lawson Reamer. We'll ask members of the public who wish to comment on this item to please call in at this time with the instructions that have been provided to you. We'll go first to Supervisor Lawson Reamer for presentation, public speakers, and then back to the board.
Thank you so much. I'm not all that much to say today. I think I just first would like to thank my colleagues for unanimously approving a related action on March 16th. This action identifies several very high priority capital projects and community investments to advance equity, inclusion, youth development, arts, and educational opportunities in the communities I represent throughout District 3. The identified projects directly address longstanding and immediate community needs in racially and culturally diverse neighborhoods. The vote also paused implementation of 2 capital projects in District 3 related to the Other Side Academy and the controversial organization Saved in America. So I think we all remember Saved in America. It's a very bad idea on multiple levels. And what we're doing today is redirecting these resources that were frankly about to be misspent towards projects that meet very high priority needs in our community. We've received hundreds of comments calling for action on these items. Residents previously expressed concern about the other 2 projects, and based on the results of our rigorous staff evaluation, today's item redirects the previously paused capital appropriations to new capital projects and community investments that are actually genuinely aligned with the community needs and priorities. An example includes the Mira Mesa Epicenter Youth and Community Center. This is a youth and teen focused arts and community center in a neighborhood that currently has no facilities whatsoever for youth or teens. It's been vacant since 2016, despite its ideal location across from Mira Mesa High School, in a community with a growing population and a significant recreational facility deficit. Mira Mesa has been identified by county staff as a target community for additional teen programming, but the effort has been challenged and stymied by the impossible shortage of appropriate space. This project would allow the community center to be reopened with a variety of youth-focused programs. For the sake of time, I won't describe every single project on the list. I do want to say in passing a word about the Del Mar program investments. Del Mar, as a community, they had been committed and were had raised the funds to invest in a desperately needed stretch of the 101 that serves all of North County. This capital investment that is an important, really a vital investment for the entire North County region has been stalled because Del Mar has seen the worst revenue shortfall of any of our cities in our county from COVID. They did not have the Del Mar Fairgrounds this year. They did not, their income from sales tax driven by tourism has dropped dramatically, and they have seen nearly an 80% fall in city revenue. So they turned to us as a COVID emergency to fund a project that has significant regional implications and benefits that they have not been able to fill that shortfall due to COVID impacts. So I think that that project is really an exception and a very particularly important exception given the COVID challenges that our community faces. So I am very excited to bring this forward. I feel very proud that so many community members have reached out in support of these projects. We had previously had a portion of CENA money that had been allocated to projects that were not meeting community needs. This action today takes that same money that had been already appropriated and reallocates it to projects still within our community, but that actually meet the needs of our community, unlike the projects that had previously been funded. So with that, I would like to ask my colleagues to join me in approving this direction to staff. Thank you.
Thank you, Supervisor Lawson. Let's now go to our public speakers on this item.
Thank you, Chair Fletcher. We have 10 requests to speak by phone on this item. Also note for the record that we received 260 e-comments on this item. We'll be calling speakers by the last 4 digits of their phone number. You'll hear a notification that your call has been unmuted. You will then need to press *6 to unmute your phone. We'll ask you to please state your name for the audio record, and you'll have 2 minutes to address the board. Also remind the public speakers that they should mute their TV or live video stream before they begin speaking. And if you could please identify the first caller.
Our first caller is 4600. 4600, please press *6 to unmute.
Hello, this is Terry Gasterland. I'm the mayor of the city of Del Mar, and I want to very much thank the supervisors for considering including the Camino Del Mar Bridge Replacement Project in the matter here being brought forward by Supervisor Tara Lawson-Remer. We wrote in a letter that you, I'm sure, have read or seen at the very least about the bridge. The bridge was built in 1932. Caltrans has determined that it's structurally deficient, and planning has been underway for a number of years now. Del Mar has a $5.5 million price tag coming up, and we simply cannot afford it after COVID impacts. Del Mar is the smallest city in the county. It has the responsibility to maintain 5 major bridges, and we've been doing our part. We will continue doing our part. For this bridge repair, it's essential. It's coming at the wrong time, and it's an important county and regional resource. This bridge connects the city of Del Mar with the city of Solana Beach. Approximately 4.6 million vehicles cross the bridge each year, and this is the Highway 101 bridge over the San Diego Road. I'll stop there, refer you to the letter for any more details that you wish, and thank you very much for your consideration.
Thank you. Our next speaker is 7999. 7999. Please press *6 to unmute.
Good afternoon. My name is Lisa Ross. I'm Vice Chair of Sierra Club San Diego, and I'm representing the chapter today. We're in support of appropriations for the Peñasquitos Ranch Preserve. That's item 19.2B, which has endured the effects of recent overuse and is in dire need of repair, restoration, and overall stewardship assistance. You've been in receipt of our letter detailing the rationale for Sierra Club support, so I'm keeping my remarks brief here. As you know, Los Peñasquitos Canyon is not just a prized open space recreational destination, but more importantly, it's an essential part of a connected habitat system that includes Del Mar Mesa, Carmel Mountain Preserves, Shaw Valley, Los Peñasquitos Lagoon, and Torrey Pine State Park, and onto county open space systems. Therefore, degradation of this preserve affects the entire habitat system. The funds will be used well, I assure you. Thank you for your ongoing stewardship of our habitat preserves.
Thank you. Our next speaker is 3849. 3849. Please press *6 to unmute.
Hello?
I can hear you.
Okay. Hi, Board of Supervisors. This is Leslie Maslin, SEIU member who believes in putting members first, county librarian with STCL at the San Marcos Library. Item 19 is close to my heart as a public librarian. Our public spaces lack adequate maintenance and expansion to keep up with our growing communities. The 4S Ranch Library plays a critical role in providing early literacy education to new parents as the highest circulating library per square footage. The library is a cultural hub to celebrate Lunar New Year, a celebration that is usually held in the parking lot, rain or shine, as the 7,000 square foot library is simply too small to host the 300 plus community members that attend. As our communities grow, we must actively invest in providing safe facilities for public use. 4S Ranch is not the only library in District 3 that needs expansion. San Marcos Library is also in need of it, as our conference room only fits about 25 people and is the only space available. I urge you to vote yes on item 19. Invest in parks and libraries to increase equity of access, provide better community service across District 3. Thank you.
Thank you. Our next speaker is 8959. 8959, please press *6 to unmute.
Good afternoon. My name is June Jo.
I'm a proud SEIU Local 221 union member, and I have worked for the county for 17 years as a librarian. I urge you to vote yes on this item, especially the proposed extension project of Forest Ranch Library. I have been the branch librarian at Forest Ranch Library since 2009. In the last 12 years, I have witnessed firsthand the tremendous growth in the Forest Ranch and Del Sur communities due to the housing development in the area. Because of the population growth, the library itself has steadily outgrown its space and could readily benefit from an expansion to improve and enhance its service to the community. The proposed expansion to the library is both critical and necessary. Forest Ranch Library has the highest circulation per square footage among all the county libraries, but it is also one of the smallest branches square footage-wise. Forest Ranch Library is also one of the busiest and the most active branches because of its top-notch special programming such as Lunar New Year celebration, Diwali Festival, Nowruz celebration, Mother-Daughter Book Club, My Masterpiece art class, just to name a few. Diverse cultural events such as Lunar New Year celebration typically attract between 200 to 300 participants and currently cannot be accommodated inside the library. While the library staff is most creative with available space, more room and resources will most definitely will be able to enable the library staff to deliver high quality programming to even more customers and accommodate more community groups who wish to use the library as a regular meeting place. So on that note, I urge you to vote yes on this item to increase equity, access, and support cultural events. Thank you for your time.
Thank you. Our next speaker is 1916. 1916, please press *6 to unmute. 1916.
Hi, this is Council Member Consuelo Martinez for the City of Escondido. And I'm really excited to see this agenda item and all the capital improvement projects that are being proposed and considered for approval today. On behalf of the City of Escondido, we're in full support of these items, including investing in park infrastructure and shading for the City of Escondido and supporting our smart irrigation projects. Escondido is definitely in need of these important funds. Many times our residents find themselves going to neighboring cities because they have more updated playground equipment and shade structures. And in our city, being that we're inland, temperatures, especially in the summer, reach really high temperatures, over 110 at times. And so we are in desperate need of shade structures, and we just want to say thank you for bringing this item forward. And we hope that all of you will support these capital improvement projects, including the playground equipment, shade structures, and smart irrigation in the City of Escondido. Thank you so much for your consideration today.
Thank you. Our next caller is 7428. 7428, please press *6 to unmute.
Hi, I'm Jeff Stevens. I chair the Mira Mesa Community Planning Group. I'm calling to ask your support for item 19, in particular to provide funding for the Mira Mesa Epicenter Youth and Community Center. This building was originally the old Mira Mesa Library and was converted to a teen center called the Epicenter that operated until 2016. Unfortunately, since then, it's been vacant and it's deteriorated. It's located in an ideal location in the center of the community and across the street from Mira Mesa High School. So I encourage you to please support this project to reactivate a critically important community resource. Thank you very much.
Thank you. Our next caller is 5323. 5323, please press *6 to unmute.
Hi, good afternoon, Supervisors. My name is Kent Lee, and I am a board member of the Mira Mesa Community Planning Group, as well as the co-chair of the San Diego Asian Pacific Islander Coalition. I'm calling today to encourage approval of item number 19, and wanted to take a moment to thank Supervisor Lawson-Loomer for bringing this forward and giving us an opportunity to look at the revitalization of a really important piece of the Mira Mesa community here, which is the epicenter as a potential teen center and community center that would serve our community. I know in a number of conversations with community groups and organizations, there's been a long desire not just to think of the space as one that could serve the broader community, but to think about how it connects different communities together. I know the Asian Pacific Islander Coalition and Pacific Arts Movement, the nonprofit organization I'm with as well, has discussed ways in which we'd love to be able to have a center that services the communities that represent us. And we think this would be important, just not from just a local perspective, but to think of it as a cultural hub as well within the community. Thank you, supervisors, for considering this, and encourage your approval.
Thank you. Our next caller is 2033. 2033. Please press *6 to unmute.
Good afternoon, supervisors, and thank you. My name is Barry Voss, and I'm the president of the Mira Mesa Town Council. I'd like to echo the comments by both Jeff Stevens and Kent Lee. The Epicenter building, which was our original library years ago when Mira Mesa was newly formed and mostly vacant, spent many decades as a teen center serving the children across the street in Mira Mesa High School. In 2016, the nonprofit who is operating the teen center gave up the lease due to financial constraints, and for 5 years, the building has sat empty and neglected. It has deteriorated and needs help. Our community foundation, in partnership with the town council, has tried for those 5 years to find a way to make this building what it was and even more. This initiative will make that happen at a time when it is critically important to provide services to our teens with the issues that are going on now, as well as Ken stated, to have a cultural hub for the entire community to come together. It has always amazed me that a community of 80,000 people has no teen center, no official community center, very small places where a large community can come together. This initiative will help our teens with the many programs available and will bring a new place for our community to join together. I want to thank you, and I want to thank Supervisor Tara Lawson-Remer for putting this forward. I urge your support. Thanks.
And that concludes public comment on this item, Chair Fletcher.
Thank you. Thank you for all those commenters and those who called in. Let me go to my colleagues. I see Supervisor Desmond.
Thank you, Mr. Chair. This is a tough item for me, and I'm going to have to register a no vote on item 2D. This is for the Camino Del Mar Bridge. Infrastructure is one of the things. When I go out in the unincorporated area, everybody asks me about road improvements. When are you going to get these roads resurfaced? When are you going to, get these roads fixed? And, each city in the region, has its own basic responsibilities. When I was mayor of San Marcos, we collect taxes, we provide basic services such as roads and infrastructure. And many cities throughout the county, if not every city, has had some, their revenues have been dramatically decreased. And if this bridge was built in the 1930s, money should have been set aside, or something, as opposed to, waiting for this moment to do the repairs. And we have a great deal of needed infrastructure improvements under the county's responsibility. In the unincorporated area, there's not enough funding right now to meet those needs. We've got over 2,000 miles of roads. Our pavement condition index is well below our 70% goal, and it seems to be stagnating there, hasn't moved much recently. And like I said, I get road requests everywhere I go in the unincorporated area to put $3.5 million towards a bridge in the affluent city of Del Mar. They may not have money in their coffers now, but they're one of the most affluent cities in their county. I think sets the wrong precedent for the limited funds, and I just can't support it, when I have to tell other people they have to wait, for their roads to get resurfaced in the unincorporated area. So I'll be supporting the item, but registering a no vote on 2D. Thank you.
Thank you, Supervisor Desmond. Let me ask my colleagues if there are any other questions. Supervisor Anderson.
Thank you very much, Mr. Chair. I thought I read someplace that there were federal money available to Del Mar for the bridge replacement, and they declined the federal money because they didn't want 2 lanes, they wanted 1 lane. Is that true, or can somebody comment on that? Does anybody know? Can staff comment on it? Do they know?
Supervisor Anderson, the staff does not know. That would be the city of Del Mar. We could certainly call Del Mar and get an answer for that, but we do not know that at this point unless Supervisor Lawson-Raymer knows.
My understanding that there's an issue with coastal assessment, coastal impact, because we're talking about a bridge that goes right over the San Dieguito Lagoon. And so the funding that we're looking to provide is a match to a whole bunch of other existing pots of money that they need to put in order to unlock those other pots of money. So there's actually a lot of money, a lot of funding coming from other sources, but they need our support to unlock those other sources of money, and they need it now because they're far behind because they had put aside and made a plan, and then their revenues were so badly decimated by COVID.
Look, it's your district, and I want to be supportive of what your priorities are for your district. But as a practice, I just want to understand, you killed some projects and you backfilled them with these, but you exceeded the dollar amount. So how does that work? I'm not trying to be negative at all on this. I just want to understand moving forward so that I prep my requests in the same fashion with the same rules. Mr. Chair, do we have a system that we've used in the past of how does that work?
We generally don't. I'm going to have the CAO comment on this. I mean, generally our capital dollars have gone towards capital programs that are either in the unincorporated area or capital programs that are directed to support county operations in the incorporated area, like a foster care, a juvenile justice campus, a behavioral health center. And so generally we haven't done that. When we're changing, we also, there's probably not a tremendous precedent of necessarily changing previous things. So in a little ways, we're in a little uncharted territory here, and I do think it's important as a board, we think about as we go forward the structure surrounding capital projects and CNA dollars and how we would like to go. But I'd love to have our CAO comment.
Thank you, Chair Fletcher and Supervisor Anderson for the question. Let me first clarify that the recommendations that Supervisor Lawson-Raymer brought forward do total the amount of the canceled projects. In the fiscal impact, it has a slightly higher number because some of those projects would potentially have some additional costs, FF&E, for example, for the Mira Mesa Teen Center, Community Center, Senior Center, that particular item. So when Ebony was helping identify what the potential cost would be, there is a slight increase of what the potential cost of those projects could be. But I just want to clarify that the actual projects, if you added up the total number of each of the sub-items, it does equal the cancellation of the appropriation for the prior 2 capital projects. Now, to Chair Fletcher's explanation, that is absolutely true, everything that he said, so I won't repeat that, but it is not unprecedented to cancel a capital project and put money into a different project. So this would not be the first time that has been done. It is a little bit unusual for us to use county funds for other cities, but again, that isn't unprecedented either. So all of these things have been done in the past.
I still want to, Supervisor Anderson, before I come back to you real quick, if I may, just to help inform our thinking, can I have County Council walk us through? We have a mix of 3-vote and 4-vote thresholds on this, and I just want the board to know our options moving forward, and then Supervisor Lawson-Raymer, the maker of the motion, can consider which way she would like to go procedurally once we're not at a vote yet, but procedurally once we arrive at a vote. So if we can just walk through our options around 3-vote versus 4-vote, because we have one recommendation. That recommendation is in total. We have recommendation 2, which has A, B, C, D, E, and F. Those are appear to me to be a mix of 3 and 4-vote items, but if you can just walk us through procedurally how we might consider this item when it comes time to vote.
Chair Fletcher, members of the Board of Supervisors, yes, you're correct. Some of the items require 3 votes simply to pass. So transfers of appropriations, which you see in 2C, D, E, and E, only require transfers of appropriations, which are 3-vote items. Similarly, recommendation number 1 to cancel appropriations is only a 3-vote item. Actions 2A, 2B, and 2F establish appropriations which are out of budget cycle and therefore require 4 votes of the Board of Supervisors to approve. You could act in total, or if you wanted to take these one at a time, the board could certainly do that as well.
Okay, thank you. We'll go back to Supervisor Anderson. I apologize, Supervisor Anderson, for cutting you midstream.
Oh, no, that's fine. Actually, that added a lot of clarity. Look, I believe that we have to support each other, whether we agree it's a priority in somebody else's district. We have to support what they got elected. We didn't get elected in their district. So I'm going to be supporting it today. But I have grave concerns that I represent some of the poorest people, and they don't have basic broadband. They don't have the roads, the infrastructure. There's fire safety issues. And by the way, you can say, well, they shouldn't be living in a fire area. That fire doesn't notice borders, and it'll come right into the city. So it's not a matter of them starting fires in the back country. It's about them being able to leave their property and flee with their life. So it's hard for me knowing that I have communities of color who are living at a poverty level. In the city of El Cajon, 19% of them live at or below the poverty level. And I think about them, and then I think about somebody who's had a tough go of it in a mansion. And it's hard for me to get there. But I'm going to respect the supervisor today, and I'm going to support this. But I had read a long time ago that there was federal money to fully replace this, and that the city council made a vote choosing not to take the federal money because they didn't like the way it was. I can't remember it. I couldn't find it. I was hoping somebody else would know about it because I certainly want them to have their bridge. I'm just prioritizing limited resources based on people in most need, basing it on equity. So thank you very much.
Thank you. Supervisor Lawson-Remer?
Well, Supervisor Anderson, I very much appreciate your support, as do everyone, not only in my district, but frankly, probably in Supervisor Desmond's district as well, who drive over that bridge on a daily basis. So it's a regional investment that's really important for folks working across the region. I do think it's important to note that if you look at the allocation of CENA funds, allocation for our district is less than 1% of CENA funds. So, you know, I strongly support that we should be investing in, you know, the communities that are in need of our investments. And I think our district asking for less than 1% of CENA allocation is pretty modest. So I very much appreciate your support in this item. And you know, I can't emphasize enough how misguided those previous CENA projects were. I think we probably have staff here who would speak to that, but they were going to be canceled because they were potentially projects that, frankly, we don't want to be on the hook for funding. That we could find ourselves in a really bad position if we continued to fund those projects, and instead putting these towards projects that are meeting needs that are incredibly important to the communities that have seen those projects, their own funding needs ignored for a very long time, as well as a regional investment that has regional implications for all of North County that I think is usually we would not consider funding, but given the crisis that this particular project faced due to COVID, that I think it's absolutely incumbent on us as the county to ensure that the entire North County region, from Camp Pendleton down to over to Fallbrook, down to Carmel Valley, that we are making sure that those needs are being taken care of as we look at realigning those investments. So thank you very much, Supervisor Anderson. I really appreciate your support today.
So essentially what we're gonna have a vote here. We have a motion by Supervisor Lawson-Remer to approve recommendations 1 and 2, including the sub-recommendations. I'll second that motion. The precedent that we're voting in support of is the supervisor making a decision to request that we cancel CENA projects that are entirely in one supervisorial district and reallocate those same capital dollars to other capital projects that are, again, in the same supervisorial district. And I think as individual supervisors, we can obviously docket anything we want for any district. But I think just so we're clear, what we are doing is Supervisor Lawson-Remer saying, I do not want these 2 capital projects that are in my district. I would rather have these capital projects that are in my district. And so if folks bring forward things in the spirit of what we have done here today, it should match that same spirit if we're going to hold true to that in terms of a reallocation of already appropriated capital dollars in a supervisorial district. Supervisor Desmond, if we vote on the totality of them, let me ask the clerk if we can register your opposition to 2D, but ask you if you would like to be in support of all of the other items, or would you like me to bifurcate the items and have 2 separate votes? Supervisor Desmond, what is is that an option to us? Okay, the first is an option. Supervisor Desmond, are you okay with that option?
I'll tell you what, because I guess with the explanation of the money staying in the district, I'm okay with that. Because I hadn't really thought that part of it through. So knowing that that's the case, and if any of the rest of us kind of, because this is kind of a new ground here, I know it's been done in the past, but it never really had any sort of form, I guess, to it. But reallocating dollars within your own district, I guess I'd be willing to support the whole item with that explanation and know that going forward, that this is a new precedent.
All right, so with that, we have a motion and a second. Seeing no further discussion, I'll ask the clerk to please call the roll.
Thank you. Supervisor Anderson?
Aye.
Supervisor Lawson-Remer?
Aye.
Supervisor Desmond?
Aye.
Vice Chair Vargas?
Vargas, aye.
Chair Fletcher?
Fletcher, aye.
That motion passes unanimously with all supervisors being present and voting aye.
We're going to move to our final agenda item for the day, agenda item 30, brought forward by Supervisor Desmond surrounding San Pasqual Academy. We'll ask members of the public who wish to speak on this item to please call in at this time utilizing the call-in instructions provided to you. We will begin with a presentation from Supervisor Desmond and then go to our public speakers.
Well, thank you, Mr. Chair. I appreciate this, and I apologize for late docketing this item. However, it is time sensitive, particularly since the state said they needed a signature by, I think it was May 28th of this month. So, as you know, on March 16th, we unanimously directed staff to seek an extension from the California Department of Social Services to keep the San Pasqual Academy open until June of 22. And before I go on, there is an errata sheet where I did change recommendation number 7. Hopefully it was on the dais or everybody got a copy of this. And recommendation number 7, I'm going to read the new recommendation 7 is to direct the CAO to add to the 2021 legislative program sponsorship proposals an item to seek legislation to amend state law that would allow San Pasqual Academy to continue operation past the 2022 extension date in its current form, along with other potential foster youth services. So I put that errata in this morning, and hopefully you all got a copy of that. But the request that we got back from the state had for the extension had 4 conditions. Many of the SPA stakeholders have contacted several of our offices asking for more time to review and how these conditions will impact the San Pasqual Academy. So I know we're coming late to the table with these provisions of the SPA. However, I continue to be very moved by the positive stories of the SPA residents and students and graduates. And I do not want to leave any stones unturned until in this process. I think the SPA is and can continue to be a very valuable tool. Now, I realize the pool of foster kids has been a success program in San Diego County. I realize, there's fewer and fewer coming, so I'm open to other uses of the particular site, but I'm very much in favor of continuing this effort that's going on currently at SPA with particularly the elder teens and going through the academy. So I appreciate the movement towards placing foster children with a family. However, for some, that opportunity isn't always a reality or the best reality. So I just want to keep this tool in the toolbox. So I've recommended that we direct the CAO to give it another try with the California Department of Social Services by asking for a 30-day extension on signing the agreement and hold off on signing the agreement until the last possible day. I've also included more detailed directives to request waivers from the federal and state to keep this San Pasquale Academy operating and alive. And I understand with the decline of children in the foster care that the SPA model may not work as it once did. However, I'm hopeful we can find a way to preserve as much of the program as possible and potentially coexist with other programs on the campus. I'm going to hold off on making a motion until I hear from, I guess, the public and our colleagues. But thank you.
Let's go to our public speakers on this item.
Thank you, Chair Fletcher. We have 9 requests to speak by phone on this item. Also know for the record that we received 9 e-comments. We will be calling speakers by the last 4 digits of their phone number. You'll hear a notification that your call has been unmuted. You will then need to press *6 to unmute your phone. We'll ask you to please state your name for the audio record. You'll have 2 minutes to address the board, and I would remind the public speakers that they should mute their TV or live video stream before they begin speaking. And if you could please identify the first caller.
Our first caller is 5192. 5192, please press *6 to unmute.
Hello, good afternoon, good afternoon to Chairman and to the Board of Supervisors. This is Shane Harris, the Government Affairs Liaison of San Pasquale Academy. And I'm calling in today to ask you to recommit make your commitment to the future of San Pasquale Academy. It is a village, and it takes a village to raise a child. There have been great successes. Of course, there's some reimagining that needs to happen. But I think we should all have a commitment to understand that these young people who live on that campus should not have found out in a newspaper article that they were going to have to move. Many constituents across the region have spoken up, and they have said that it is time now to preserve San Pasquale Academy, or at least to grant an extension, a reasonable one. The recent letter that was sent back from the state, it is very clear they are playing switch and bait. They have said that they're grant an extension, but if you sign on to that extension as is, it will kill the academy quicker. Why? Because right now there are 82 students. When you take out 14, you get the amount down to the math, you see that the ultimate goal is to close the academy down quicker than October, being that there are currently 82, 14 graduate next month. The goal is to close San Pasquale down quicker. I'm asking you to make a commitment today to ask the state to take the condition down. Maybe there's a negotiation within there, but to completely have a negotiation up on an extension that we will only grant you an extension or you'll only sign on to it if you will be able to stop taking new referrals from foster youth across the county. It's just not reasonable. Youth need a place to go. SPA provides opportunity for those youth who may not get into a foster home, and we need to think very hard about what we are doing. So I'm asking you to commit yourself. Please look at this from a humanity issue, and please ask the state to take that condition off because it is not realistic, or ask for a negotiation within that condition. So maybe 20, 30 new youth can be there, but instead of no new youth at all. Thank you.
Thank you. Our next caller is 4557. 4557, please press *6 to unmute.
Yes, my name is Debbie Syverson, and I am speaking on behalf of San Pasquale Academy. I'd like to read this to you. We are the current students at San Pasquale Academy. We are the future success stories, positive contributors to the world. We are supposed to be under your care and your protection, but since Sunday, February the 21st, we feel we have been forgotten about us. focused on policies and money rather than health, education, safety, and futures. We are ages 12 to 19 and have been at SPA ranging from 2 months to 5 years. No matter the length of time that we have been here, the impact of the community has been overwhelmingly with support, acceptance, nothing we have ever experienced before. We are collective, diverse, ethnicity, ages, genders. We are survivors of trauma that happened to us with our biological families and in the previous foster care placements. We are thriving at SPA. We matter to each other. Do we matter to you? We invite you to visit our home, meet us, and hear our stories. We want you to know what this community and home truly means to us, as you do not fully understand how your decision is directly and negatively affecting our current lives and our future. SPA is our community, our family, our home. SPA is a stable, reliable, permanent, safe haven for us. Our individuality, self-expression is embraced. We are more than a number. This community is loving and teaching us how to love ourselves. We ask you, how would you feel if your family home was being taken away from you and you had no say in it? How would you feel if there was nothing you could do? Would you be afraid about the fate of your future? Would you sit back and let it happen, or would you fight to keep it? This is what we are trying to accomplish. We want to keep our home. Please reconsider keeping San Pasqual Academy open for these reasons. We need our home. We need our community. Thank you for allowing me to speak.
Our next caller is 9364. 9364, please press *6 to unmute.
Thank you. This is Michelle Krug, and I'm going to take advantage of this opportunity to tell Supervisor Desmond how appreciative and how grateful I am that you are taking this fight on. And as you said, leaving no stone unturned. I am so committed to SPA and the results that I have seen. As a kid myself who left home at 12, I totally relate to what a situation like this would have done for me. I turned out okay, but this would have been so much better. I offer myself to help in any way on advocacy, state or federal. Your colleagues definitely know how to reach me. And I just really want to say thank you and let you know that I'm in the fight, and I really appreciate your investigations as to every possibility that we can do. The previous speaker spoke about what it means to these kids. I couldn't say it any better. Thank you.
Thank you. Our next speaker is 0460. 0460, please press *6 to unmute. 0460.
My name is Kelly Davis. Thank you, Supervisor Desmond, for fighting for the most marginalized youth in San Diego. Please listen to the taxpayers and citizens of San Diego County. Save our schools. We have unprecedented budget surplus in California. We can afford this school for foster youth. Yes, the population of San Diego's foster youth has declined in recent years, but who is to say it won't go up, especially at the tail end of a pandemic? There will always be a need for San Pasqual Academy. They do not cherry pick their students. They make choices in order to protect the welfare of everyone at SPA. Enrollment is down because Child Welfare Services sent out a memo ceasing placement of foster youth at San Pasqual. The talking points being circulated by some on the Board of Supervisors are only meant to distract from the fact that the citizens of our county passionately want to keep this unique place open. As taxpayers, this is our land. This is our school. Listen to us. We are begging you. Thank you for improving our juvenile detention center. San Pasqual Academy keeps foster youth out of detention centers. Supervisor Lawson Raymer, Supervisor Anderson, please tour San Pasqual. It's an inspiring place. Nathan Fletcher, you attended a graduation in 2018. Please go actually tour the school. The students deserve at least that. Thank you so much.
Thank you. Caller is 0460. Please press *6 to unmute. 0460.
Hello, my name is Jeffra Becknell. Over 20 years ago, I was part of a visionary team of educators, child welfare workers, judges, and others who planned and created this amazing, life-changing institution. I taught at San Pasqual Academy for 10 years, and I saw that San Pasqual Academy works. The Academy continues to accomplish its mission every day. Foster youth have a 53% graduation rate statewide, and SPAs is higher. Only about 2% of foster youth get a college degree, but many SPA students have graduated from college, including my student from the class of 2005, who on May 15th received a master's in education with teaching credentials in 2 subjects. Other former SPA students are working, raising families, adulting. Raising children is expensive, especially our county's most vulnerable children who have suffered multiple traumas before they even get to San Pasqual. Foster care is cheaper than high-quality congregate care, but that doesn't mean it's better. Yeah, SPA is a substantial investment. It's maybe more expensive than foster care, but it's worth it. SPA is a complex place requiring constant balancing of individual and community needs with all of the tough decisions parents make on a daily basis. But San Pasqual Academy is what happens when you combine vision, sufficient money, accountability, and love. Nelson Mandela once said that the true character of society is revealed in how it treats its children. You have the opportunity to fight for San Diego's foster children, to have the option to be a part of a caring, transformational community. Don't let them down. Thank you.
Thank you. Our next caller is 0874. 0874. Please press *6 to unmute.
Hi, I'm Joan Scott with Friends of San Pasqual Academy. Ironically, May is also National Foster Care Month, and we do not want to overlook our foster kids. Regarding San Pasqual Academy, Family First Act is purely a funding bill, and it is not illegal for San Pasqual Academy to admit and care for kids. SPA can continue to operate without being under the Family First Act. SPA receives $1.4 million in federal funding. With the state's huge surplus, this expense can easily be absorbed. Waivers, exemptions, and modifications are frequently made by both state and federal officials. We keep hearing that there are 2,200 foster kids, but as confirmed last week by HHS, in 2020, there were over 3,500 kids in foster care, and this number is increasing. Also confirmed is a shortage of foster homes. To financially motivate people to become foster parents will be a disaster. More lawsuits will continue and more kids will be placed at risk under your care. The enrollment at San Pasqual can be increased immediately. There are kids waiting months in short-term facilities causing more trauma. Many solutions to increase enrollment are available. Lowering the age, providing trauma-based services are just a few of the possibilities. Please don't close a proven much-needed program. We realize there is a need for a behavioral health site, but not at the expense of our foster kids. We are putting American youth at risk again. SPA was built for foster kids. It is the nation's model for foster kids for over 20 years. We ask you to quit blaming state and federal officials. Your legacy is that you kick foster kids out of their homes and threw them into a system that fails them. This happened on your watch. It is you who can change this. We know you care about them, and thank you for fighting to keep SPA open. Your actions are greatly appreciated. Do the right thing. Protect our foster kids and keep San Pasqual Academy open. Thank you.
Thank you. Our next caller is 1357. 1357. Please press *6 to unmute. 1357. Please press *6 to unmute.
Good afternoon. My name is Kathy Latham. Thank you, Supervisor Desmond, for bringing this topic forth to the board today. We can all agree that the best place for every child is in a home with a caring family. Unfortunately, the harsh reality is that there is a lack of safe foster homes wanting teenagers. The AB 403 policy, family or nothing, is wrong. Currently, there are no background checks being made on potential foster parents. This is dangerous and puts foster kids at risk. You are supposed to protect them, and more lawsuits will result in this risky situation. Foster teens are frequently running away at Polinsky Center, which is full and supposed to be a temporary placement. Last Friday, 10 or more ran away. SPA is a wonderful option, trauma-informed for many teens. The students at SPA have been meeting with their social workers and are being asked if there is a relative or anyone with whom they can be placed. When they answer no, they are distraught because they were led to believe that SPA would be their last placement until graduation. The overburdened foster care system has failed them again. Where are these teenagers and siblings set to go? Closing SPA will result in even more homeless youth and worse. SPA is widely considered a model for transforming the lives of teens. It has a 94% graduation rate compared to 45% graduate for foster teens not at SPA. It has been mentioned that SPA cherry-picks their students and that they would have succeeded anyway. Not true. Before arriving at SPA, most were failing school, had several failed placements, were homeless, and in and out of shelters. These kids thrive at SPA because they work hard academically to catch up and are given an opportunity to receive all the support needed in one place. Be the safety net. Please vote to take steps toward making San Pasqual Academy permanent, allow more student enrollment, and give foster teens a chance. Thank you.
Our next speaker is 5760. 5760. Please press *6 to unmute. 5760. Please press *6 to unmute. We can see that you've unmuted, but you may also have to unmute your phone.
How's that? Can you hear me?
Yes.
Hello, my name is Andrea Reynolds. Thank you for the opportunity to speak. By the time a foster child comes to San Pasqual Academy, they have been through horrific circumstances. Some know what it is like to sleep in public bathrooms and on park benches, not to mention the emotional, physical, and sexual abuse they may have suffered. They are behind in school, yet they face having to live independently in just a few short years. They are traumatized, angry, and in pain. Many of them need intensive emotional and academic support beyond what a traditional foster family is equipped to provide. Sure, some may do fine if placed with a family, but many of them will not, so we need an alternative for them. The Academy is that village. It provides youth with layers of in-house support, house parents, therapists, teachers, coaches, grandparents, all on one campus, easily accessible to them. There's a synergy here that cannot be replicated if the youth are scattered across the county. At SPA, the teens can heal among their peers who have endured similar hardships. They lean on each other and lift each other up. You cannot recreate this sense of community if the teens are tucked away and isolated from each other. Lastly, if you allow SPA to fold, we will be left underprepared to meet the growing demand that San Diego is facing. Supervisors, you have the power to make it happen if you truly want to. Please fight to keep the Academy open to serve our most vulnerable youth. Thank you.
Thank you. Our next caller is 0053. 0053, please press *6 to unmute.
Hi, I'm Terry Summerhays. Thank you for your successful request
to the state for an extension of SPA to operate till June 2022, requesting that you continue to immediately negotiate with the state and federal to carve out an exemption to keep SPA open permanently. Our foster kids that are in your care need the successful home and school to remain open. It is not a congregate care home. It is a residential school where the kids live in individual family-style cottages with house parents in a loving, safe, caring environment. Using data and thoughtful research to evaluate what works, let's scale up the successes of SPA and fight to keep it open. Let's consider evidence, data, and the track record. History. SPA was created 20 years ago as a solution to what was broken in the foster care system. Juvenile court judge taught and listened to the foster teams, and SPA was a solution. 20 years of successful operation, 94% high school graduation rate, significantly higher than that of other foster youth. The testimonies and voices of SPA alumni and current students, you've heard them, some today. The grand jury report lauding SPA's successes. The results of the 2020 extensive UC Davis studies concluding that SPA is a model for foster care. I quote, SPA is a model program for adolescents and emerging adults transitioning from foster care on page 60. My own positive observations for over 18 plus years and those of hundreds who have donated their time, talent, and treasure in support. We've witnessed these amazing youth heal and overcome immeasurable obstacles due to the incredible holistic support of the SPA community, and we've watched as they become successful contributing adults. Isn't that our goal? Please do the right thing. You have the power. Use your leadership to immediately work with the state and federal to carve out the exemption necessary to keep this well-established school open permanently. There's no greater use of this facility. It works. If there's a will, there's a way. Thank you.
Thank you. Our next caller is 5457. 5457, if you wish to speak on this item, please press star 6. 5457, if you wish to speak on this item, please press star 6 to unmute yourself.
Good afternoon. My name is Inga Entriago. I am calling in today to support of San Pasquale Academy. The recent letter from state officials should not be agreed to by the county under these terms. SPA should continue to be able to receive new referrals to the campus and be granted a reasonable extension under reasonable terms that does not kill the academy sooner. Please request state officials remove. And I'm also an advocate for foster care youth and the welfare of foster care children. I do have immediate family members that have grew up in the foster care system and have lived very, very successful lives, graduated from colleges and universities with business degrees and also MBAs. Please request state officials remove that condition. Again, thank you for your time. My name is Inga Triago, and thank you very much, Supervisor Desmond, for this agenda item, and good afternoon to the rest of the supervisors. Thank you.
Thank you. Our next caller is 1370. 1370, please press star 6 to unmute yourself if you'd like to speak on this item. 1370, please press star 6 to unmute yourself if you'd like to speak on this item. We'll come back. Our next caller is 7725. 7725, please press star 6 to unmute yourself if you'd like to speak on this item.
I'm unmuted. Am I on?
Yes.
Hello, County Board of Supervisors. Chairman Fletcher, thank you very much for giving me the opportunity to speak on this topic. There's no doubt in my mind that Chairman Fletcher is not an advocate for kids. In fact, he championed Chelsea's Law. And I happen to know that his heart, and as well as the other board members, are in the right position. But one thing that really needs to be addressed when we're looking at San Pasquale Academy is homelessness. One of the best ways to prevent homelessness in San Diego is to address the issues that cause homelessness. And the San Pasquale Academy for Foster Teens does that. Among the greatest population at risk for homelessness are young adults who care out of foster care. In San Diego County, there's almost 3,000 kids in foster care. Therefore, many of the kids in the system every year are going to age out and they're going to end up on the streets, becoming victims of all sorts of different crimes. They are our future homeless population. In fact, nationwide, 40 to 50% of foster kids become homeless. The San Pasquale Academy addresses many of the issues that cause homelessness. So it's imperative that our elected leaders, that is the San Diego County Board of Supervisors, lobby the state and the governor, specifically the governor, to change its designation so it can be removed from the constraints of Assembly Bill 403, because that's why we're in there. It's categorized as a congregate care facility when we know it's not. It is not a congregate care facility. It is not a group home. The San Pasquale Academy is, in fact, a shining example of what San Diego County can contribute. We can't lose this resource due to inaccurate categorization as a congregate care facility. And since the Academy, and this is the important part, helps to prevent homelessness, local, state, and federal funding allocated to combat homelessness should help fund the Academy.
Thank you. And can you please state your name for the audio record?
My name is Mark Powell.
Thank you.
Recalling 1370. 1370, if you'd like to speak on this item, please press *6 to unmute yourself. 1370, if you'd like to speak on this item, please press *6 to unmute yourself.
Chair Fletcher, we're not seeing any movement from that caller. That appears to conclude public comment on this item.
All right, thank you. Supervisor Desmond, back to you.
Well, thanks. I kind of wanted to hear from our fellow board members as well on this.
Okay. Are you going to make a motion so we can discuss the pros and cons of a motion?
Well, it's the board letter itself come through. I just, I'll go ahead. I'll make a motion to approve with the errata that I submitted. Hopefully everybody got that or is familiar with it. The errata there that I read earlier. I'll make a motion to approve it.
Is there a second to Supervisor? Seconded, motion by Supervisor Desmond, seconded by Supervisor Anderson. I have a couple questions for staff. One, have we already requested flexibility around transferring additional youth to San Pasquale with the state of California between now and the June 30th extension?
Yes, Supervisor Fletcher, I have asked already.
And what did the state say?
They were not willing to change that.
So we've requested already of the state to give us flexibility to continue to move youth to San Pasquale between now and June 30th, and they have said no. If we don't enter into the agreement which has been presented to us, then what is our option?
If we do not enter the agreement, then the original closure date of October 1st stands.
Can you touch, Kim, for us on what is the capacity presently at Polinsky? I think we're hearing some misinformation about that. It doesn't appear to align with my understanding of having been there.
Yes, Polinsky Children's Center has a licensed capacity of 204 youth. As of today, we have 42 children at the facility.
204 is capacity, and we're at 42, so it's not busting at the seams.
No, it is not.
Do we have placements in terms of if we have to transition San Pasquale and some of those youth have to be moved, do each of those youth, will they have a place, a loving and stable environment to go? Or is there a shortage of locations for foster youth presently?
So that is what we are working on right now, is to ensure that all of those youth will have a stable place for them to go.
So we're at a position as a board where we've got to make a decision around what we go, and the decision is in part driven out of our deep love and appreciation for foster children, and as a board, our commitment to do everything we can to support them. Now, many decades ago, the deep love and appreciation for foster kids is what created the San Pasquale Academy. At that time, there were not locations for many of these kids to go. There was a federal and state model that allowed these types of facilities to exist, and it has been successful over many, many, many years. But the love and commitment that we have to foster kids requires us to address what is best today in light of the situation that we're in today. And as a board, we face a choice before us. Are we going to reimagine and restructure San Pasquale Academy to serve the needs of San Diego youth? or are we going to allow it to close? Those are the two options in front of us. Federal law changed across the board. Federal law is not going to unchange as it relates to this, because that change was driven by decades of research around what is best for foster youth. Not out of a love for a building, or not out of a love for something that started decades ago, but out of a love and appreciation for what is best for foster youth. That's why federal law changed. This is not a funding issue. State law changed. Unanimously, I might add, in the Senate, including support by then Senator Anderson, the California State Senate unanimously changed congregate care in California. The Assembly unanimously changed the approach to congregate care in the state of California, and the governor at the time signed that out of an appreciation for doing what is best for foster youth. And now as a board, we have to confront a very difficult situation that forces us to acknowledge the reality of the situation that we're in. And we can continue to say, well, we'll just vote to call on someone to do this and call on someone to do that, but that's not going to happen. State law is not going to change. Federal law is not going to change. Decades of best practices and approach to foster care are not going to change. And the opportunity we're missing, that we have been missing now for the last 5 months, is to truly commit ourselves to reimagine and restructure San Pasqual so that it can stay open, because there are opportunities in front of us for how both youth and foster kids can be served there. There are opportunities for pregnant teens to be there. There are opportunities for sexually exploited youth to be there. There are opportunities for foster and other youth who has serious mental health issues and need a level of care who can be there. But we have to accept the reality that we have to restructure and reimagine what we're doing. And the longer we drag this out, and the longer we make arguments that are not rooted in data and research in what is consistent with state law and what is consistent with federal law, the longer we avoid doing what is best for kids. And so I know and appreciate how committed folks are to the present model at San Pasqual, and I know and appreciate how much good it's done over the years, but the circumstances around this have changed. And so our choice is to acknowledge that change and embrace that change, to come together as a board and come together as a community to best serve our youth, or to just keep dragging this thing out until the license is gone. And when the license is gone, it's closed. And then we will have missed the opportunity to truly do what is right. And the easiest thing in the world would be for me as a board member to say, oh yeah, we're just gonna pass a resolution and call on the state to do something that we all know they're not gonna do. Everyone that has invested time in this issue knows it's not gonna change. And so all we're doing is not being honest with everyone who is there. We are not serving the youth that are there best by having a thoughtful and constructive transition plan, by addressing their individual needs. We're not serving the alumni at San Pasqual best by addressing what San Pasqual means to them. We can continue operations and programs to support the alumni. We can continue to do that on that site. We're not seriously investing ourselves in all of the options and alternatives, because the longer that we distract from something that somehow we're gonna get the entire country of America, the entire United States Congress, United States Senate, President of the United States, State Assembly, State Senate, and Governor to immediately say, yes, we changed the entire approach to foster care except for you, San Diego. The longer we continue to hold out the notion that somehow that's gonna happen, we won't invest in these other options. And it is our love and appreciation and commitment to foster care that compels us as a board to say it is time to reimagine and restructure San Pasqual to continue to be a place to serve foster youth and youth in San Diego County, but under the legal structure of state and federal law. And this is an opportunity that I think it is time for us to revert and focus on what is best. And so I'm going to make a substitute motion to direct the Chief Administrative Officer to diligently work with stakeholders, including the incredible group of foster youth who have come together and organized as a community for suggestions, to reimagine and restructure how we serve foster youth and youth at San Pasqual Academy consistent with state and federal law. And to include in that we look at issues around transitional housing, issues around how to serve the alumni who have graduated from San Pasqual, issues around investments in the entire system of care, and return to this board with what those options are, what those funding decisions would be, and how we as a board can come together again to reimagine and restructure San Pasqual Academy as a place for foster youth and youth in San Diego County, consistent with state and federal law. That would be my motion. Is there a second? Yeah, I'll second the motion. Second by Vice Chair Vargas. We'll go to Vice Chair Vargas.
I'll get this. Thank you, Chair Fletcher. And I wanted to say that I did have an opportunity to visit San Pasqual. I had not visited the campus before. And one of the things that I kept hearing is the camaraderie and the connection between the alumni and the power of the alumni. And so I think to your point, as we are seeking this motion, there's an opportunity to find ways to ensure that that alumni can continue to work together and find opportunities so that they are engaged and mentor and work with other folks. I think that would be a really powerful component because I heard it loud and clear from them individually and also in the children's committee that we serve on. And so I do agree that it's time, I think, for us to really make a difference, long-term institutional change that needs to happen for our county foster youth because they deserve the best. And I know this is an emotional issue for so many. I witnessed it firsthand. They've called and I've met with them as well. And so my hope is that we find a good solution that is a long-term solution for our kids because they do deserve better. So I'm proud to second the motion.
Thank you. Supervisor Lawson-Remer.
Thank you very much. I think this is obviously a very emotional issue because it's so important. There's no question that we need to do everything we can for the young people in our community, and especially the people that are so often neglected and left out. And I think that's been, for a very long time, the spirit of San Pasqual. Certainly was the spirit in which it was founded, and I know that's the spirit that drives the many, many advocates and all the alumni who are so dedicated to championing the San Pasqual Academy. You know, when I look at this, I think we need to think a little bit more outside the box, right? It's very clear that we're stuck. We're stuck by the federal government, we're stuck by the state government, that we can't continue to operate San Pasqual as it currently is constituted. On the other hand, I personally am very committed to keeping San Pasqual open. So I think to me, the path forward is to work together as a community to identify how we can keep San Pasqual open in a different capacity, in a different format, in compliance with state and federal law. Because I think there are a lot of options. I think we've gotten ourselves sort of in this cul-de-sac or really a dead end because we're looking at things in a black and white way, in a dichotomy, you know, either open or closed. And I don't think that's the way forward. I think the way forward is to look at how we build on the incredible investments that have been made in foster youth and in building the San Pasqual Academy, and build on those investments and take them to another phase, a next phase that is in compliance with what is actually possible. I'm really concerned that if we continue on the way that we're going, that we're going to lose San Pasqual entirely. It's going to be closed because we will not have done the work to identify the approaches and the strategies to keep it open that do comply with the state and federal legal guidelines. And I think that there are a lot of options and a lot of ways that we can keep San Pasqual as an incredible resource to serve our community in a way that does serve and prioritize the needs of youth in our region, that does comply with state and federal law. So that's what I've been thinking a lot about, is that we really need to think ahead, or else we're going to be a year from now in a worse position than we are now, because we will have received this waiver, this one-time waiver, and then what? And then we've not made any other plan, and then we're out of runway, and then we have to close. And I do not want us to do that. I do not want us to run out of runway and close. And I think the only responsible thing to do, if we want to continue to invest in youth in our community and continue to build on the inspiring successes of San Pasqual Academy, is to look at how to keep it open in a way that complies with state and federal law to serve the youth of our community by realigning the purpose and the community served in order to comply with what's actually possible. So that is what I would like to move forward with today. So I think I'm concerned about Supervisor Desmond's motion, that it seems like it's continuing to bang our head against a wall that's closed, a door that's closed, that we are not able to open, and that in the end, we will just run out of runway and we'll have to close SPA, and I don't want to do that. So I'm not in support of Supervisor Desmond's motion because I do not want to close San Pasqual, and I think that's the inevitable result of what he has put forward today. So I do want to better understand Chair Fletcher's motion. I think what I'm hearing you say.
Can you want me to restate it for you?
Please, yeah.
So there's 4 parts to it. Direct the Chief Administrative Officer to work with stakeholders, including our foster youth and other groups, to reimagine and restructure San Pasqual Academy consistent with state and federal law to serve the needs of foster youth and other youths in San Diego County. To include feedback from stakeholder groups, including the Child and Family Strengthening Advisory Board, the recently formed foster youth group surrounding San Pasqual, and other interested parties in this process. 3, to include in this evaluation the opportunity to serve the alumni of San Pasqual, to explore the use of transitional housing to help our foster youth and other youth in this, and any other recommendations that tie into the broader system. And then 4, to enter into agreement with the state of California for the extension and prepare appropriate transition planning consistent with that agreement.
Thank you. I very much appreciate that. So I think what I'm hearing is very much in accordance with what I think we need to do, which is do the work with leadership from the foster youth that have been impacted, and the alumni and the community that's invested in San Pasqual, to keep it open in a different capacity, in a way that actually is allowed and is legal, and to really invest our county staff resources and time and attention to making that a priority, and asking staff to work with those stakeholders to come back to us with some really grounded and vetted options that would allow us to make a transition plan that will continue to meet the youth in our community. So I think that's what I'm hearing you say. That's absolutely what I support. I don't want us to end up running out of runway because we continue to run against a closed door. And I really want us to do the work to keep San Pasqual open to serve our youth. It seems like the best way to do that is to make a plan led by stakeholders that complies with state law, and come back to us with some options so we can actually have a more grounded conversation that's grounded in what's real. So I think that's what I'm hearing you say, and I would certainly be in support of that.
Thank you. Supervisor Anderson?
I think we all want to put the kids first. You know, everyone speaks and they think that we're against the kids. We're not against the kids. But I agree with Supervisor Lawson Reamer that we've been banging our head on the wall. And by the way, thank you very much, Chair, for pointing out that I voted to close it, along with every colleague in the legislature. There was no opposition at the time, just for the record, and I did tour it about 8 years ago when I was a state senator. We thought at the time that it would take a different path, and that the kids would still have a program, but it may have to look like something else, because we knew at the time the feds were no longer going to support it, and the writing was on the wall. And I also want to do a shout out to our colleague, Supervisor Desmond. I think the reason why Supervisor Desmond, I don't want to speak for him, but I am, I think the reason why he wanted to hear our opinions was, I think that he put this board letter forward so that we would have an honest debate, because we all, without talking to each other, agree the kids need to come first. And Chair Fletcher, I want to thank you for that motion. And I'm hoping that when you recognize Chairman Desmond, that perhaps he'll withdraw his motion so that we all can vote together collectively and show our support for the kids. and show support for the community. But we can't continue down the path that for the last 3 years has failed. And I agree with you, Chair Fletcher, that we have to be more responsible because those kids are counting on us. So we have to think of better ways of meeting the same needs in a way that's lawful. Thank you.
Thank you. Supervisor Desmond.
Well, even though it looks like my motion, and I'm willing to withdraw it, but I'm glad, I brought it forward because this sparked a lot of passion and energy. And this, I think we all agree that we want what's best for the kids. I will, point out, I do have a difference of opinion that, since there's room at Polinsky's okay. Polinsky is no spa at all. So I also, disagree that, the state says no, we walk away and say, okay, well, we got to comply with the state. I was in sales. You never take the first no. And so I'm willing to, I was willing to go keep asking again. I agree with some of the callers, one who said, spa was being miscategorized. And I do think waivers are a possibility. And one of the callers mentioned they happen all the time. But I think we all agree we got something really good here. This spa has done great things for our foster youth. This is a jewel in our of San Diego County. Even the report, the Davis report says this, it's one of a kind. So I kind of hated giving up on it altogether, which I don't think we're doing. And I do think we need to keep it open. But one of the things I guess I'll ask of you is in the restructuring and the remodeling, which really, I agree we needed to do. We need to do some sort of restructuring. We have to put in other programs. The current capacity at SPA is not what that site, will allow. It's much less, and there's much more possibilities to put there. So I'm in favor of using the, other uses in there. I'm just wondering though, does your approach that you're putting forward, does it potentially allow, if we can get it, the program that's happening now, or some version of the program that's happening now for these teen youth, if they don't fit in to the home, into a home, or they're struggling with that? Is that a possibility that you're willing to allow if that's how this new model comes back?
Well, I think Supervisor Desmond, we got to look at all options that are allowable under state and federal law. And there are options where we can provide services to foster youth and other youth in San Diego County. There are things that we can do. There are things that we can't do. And I think we need to explore all of the things that we can do. Because what I think is most important is that the San Pasqual Academy can continue to be a place that serves our youth. And it can be a place that continues to serve foster youth. But it's going to be different than it is today. It's going to be a different model, and it's going to provide different services, and it's going to do different things in different ways. But we're not going to fully invest in exploring. Look, a number of folks have been approached about, hey, we could do this and we could do that. And they said, no, we're not talking about anything because we just want to keep it exactly the way it is now. And that's just not a realistic option in front of us. And so that's what we're saying, Supervisor Desmond, is explore every option for what services could be provided there consistent with state and federal law. And if we get focused on that, I think there's going to be a whole lot of good things that we can do. But we got to get over this hurdle first to acknowledge that it is reimagining and restructuring consistent with state and federal law.
Well, I get that, and I also get that waivers are possible. And I just, I really love the program that's in place there right now. I understand that the state doesn't allow it, and we want to get in line with the state law. But I just kind of hate to give up, or I'm not ready, I guess, to give up. I'll support the motion. I appreciate, your passion in trying to get this done. It's still in the back of my mind. If there's a way to keep the program that's there, that's working so well, I'm just not willing to give up on it yet. But I appreciate the movement of this board in the right direction. Thank you.
Thank you. And just so we're all clear, if we adopt this, we are moving forward with trying to reimagine and restructure consistent with state law. And that will be the stated position and approach of our board. So we have a motion by myself, seconded by Supervisor Vargas. Just restate so we're all clear. Direct the CAO to work to reimagine and restructure youth and foster services at San Pasqual Academy that are consistent with state and federal law, to include feedback and engagement from stakeholder groups, including Child and Family Strengthening and Advisory Board, the recently formed group of foster youth from San Pasqual and other interested parties in this process. 3, to include in this process services to serve alumni, the exploration of transitional housing, and any changes in our broader foster care system that might be a part of this. And to 4, to enter into the agreement with the state of California for our extension till June of next year and commence all needed transition planning. With that, we have a motion and a second. Not seeing any additional comments, I'll ask the clerk to please call the roll.
Thank you. Supervisor Anderson.
Aye.
Supervisor Lawson-Remer.
Aye.
Supervisor Desmond.
Aye.
Vice Chair Vargas.
Vargas, aye.
Chair Fletcher.
Fletcher, aye.
The motion passes unanimously with all supervisors being present and voting aye.
That concludes the business before the board today. We do not have any adjourn in memories. Our board will move into closed session.
The board will now recess into closed session to consider those matters listed under item 31 on today's agenda. If there are any reportable actions, they will be reported out prior to the start of the planning and land use session of this meeting tomorrow, Wednesday, May 19, 2021.